communication style. Okay, so this didactic is about that. And then there will be spiritual assessment didactic by Donna. You have a lunch. And then in the afternoon, we'll have Buddhist pastoral care for Buddhist patients by Ram. Ram is very well experienced Buddhist chaplain. And Donna will do what is a chaplain didactic after that, and I'll do personality theory-based pastoral care after that. Every unit in our center has different theme, and the theme of this unit is personality-oriented pastoral care. So that's why I'll provide that, okay? All right. Good morning, Jim. How are you?
Good.
Good. Good to see your smile. Welcome. Welcome back. Okie doke. So let me pull up the handbook. So yesterday I talked about the policies and part of the outcome indicator. Okay, we covered until indicator 5, I think. So that's where we were left off yesterday, and I'll resume from that. I assume everybody has a copy of student handbook, right? If you don't, let me know. I'll send you again. This is not where we're left in. We're going back to the definition of CP outcomes and indicators 4.2. This is where we are today. So yesterday, we covered until 5, I think. 5. Or were we covering 5? Let me see. 1A5, describe 1A, level 1A. Describe how one's values and beliefs about spiritual care are part of one's, yeah, we covered this, okay? Yeah, 4 and 2. And then category B, awareness of self and others. Outcome 1, which is subcategory, self-care. Under self-care, outcome 1, there's indicator 6. Okay, level 1A. If you're beginning students, 1A6, demonstrate knowledge of the varieties of self-care and initiate the use of self-care practices. So it's basically asking, do you know there are so many diverse kinds of self-care concepts and practices? And then have you begun to use that and practice for self-care? So that's what it's asking. If you're 1B, tell me. That's what it's asking. Tell me how your self-care practices are going. What are you doing with your self-care? Okay. What are your practices? And also, this includes trauma-informed approaches, because why has it to do with your self-care? Because when you are not doing a good job for your self-care, you are driven by your past wound and hurt, more than likely. That's why. When you're more collected, composed out of enough self-care, it's less likely that you'll be controlled by your past wounds. Okay, so it's like two sides of the same coin. So on one hand, you want to do a better job in terms of doing your self-care. On the other hand, you want to double check how much you're driven or swayed or controlled by your own trauma, okay, coming from the past. And how much are you aware of this is intersecting with the trauma of your care recipients? So you can choose the right intervention, right approaches. Okay. And then if you start using it, if you start recognizing and be able to explain that on your verbatim, on your weekly reflection, then you met the goal for 1B. That's Jennifer. And then skip. 2A, demonstrate how you use self-care practices, including trauma-informed approaches for support of well-being, including when providing spiritual care. So it sounds kind of similar, but the big difference between 1B and 2A is that you are regularly doing it, meaning recognizing it and choose the right intervention in the middle of the visit when providing spiritual care, not after. That's the big difference. Okay, that's 2A. 2B, not only you are recognizing and practicing it in the middle, okay? 2B is that when you find something is going off the track in terms of this self-care, countertransference, and trauma-informed care approaches, that you can become your own educator, evaluate your course, and change the course of your approaches in the middle of the visit. So by the time you bring it to your class on your verbatim, you're pretty much done with all of your, assessment and then evaluation and change the course. You pretty much like you report to your educator in the class about how you have changed, how you have everything, okay? Now you become your own educator. So that's 2B. That's for Alfredo and the Victor. All right, outcome 2, justice-seeking awareness of bias. Demonstrate an awareness of implicit and systematic bias, including cultural and value, belief-based prejudice, and its impact on spiritual care. When we talk about the bias, I hope that you don't get confused or biased with the word bias. We're not talking about racism only by the word bias. There are so many other biases, okay, other than racism. So you don't have to be defensive or protective of yourself in this issue. Everybody has some kind of bias. Everybody, okay? The question is, are you aware of the bias? It's not just about the implicit and systematic bias, but your own bias about the systematic bias about other cultures, okay? It's not just talking about, okay, I see some bias happening here and there, okay? It's also talking about your own, okay? So that's the 1A. And the 1B is that now you could focus more on your own bias. Not only that, but also you are able to using it, use the concepts, then you provide care and be able to talk about that. Okay. So what kind of bias you might have? I had students, first unit students, whenever he wrote about the female patients, he used to refer to the female patients as ladies. Okay, so we were asking, not just me, his colleagues were asking. So we wonder, where you're coming from when you referred to the female patients as ladies. Okay, there can be small biases we all have. And I told you yesterday about my biases about sexist comments, okay, when I said ladies first. And when I was growing up in Korea, in Korean culture, which is very much patriarchal, men-oriented culture, um, I thought there's different roles for men as I was growing up. So that's one example is that anything happening in the kitchen, men are not supposed to be involved. And I learned it from my grandma because when I was going to go into the kitchen area to have a cup of water, and then when my grandma saw me, walking into the kitchen area, she slapped me on my back like, and she told me, "You're not supposed to be here, man. Okay, off of the kitchen. If there's something from the kitchen, you need to ask your mom or your sisters." That's the sexiest world that I was growing up in, the culture. I had no idea how bad that was until I came to America, and until my two daughters picked on me. Dad, you are making sexist moves and sexist comments. Don't you ever do it. Minor stuff, you'll be surprised. Okay? But again, it's fair because everybody has some sort of bias. The question is, are you willing and are you courageous enough to recognize and to talk about it and articulate about that? Okay? And it'll be fair because whenever it's your turn to present, all the other colleagues except you, they will recognize it for you. It's fair. Don't you worry. Okay, so that's 1B. 2A, demonstrate. Now you have to demonstrate regularly. Okay? The key word for 2A is regularly. Demonstrate regularly how, excuse me, you are addressing your implicit bias and systemic bias when providing spiritual care in the middle of the visit, not after, regularly, as appropriate to your context. That's the big difference between 1B and 2. Now you're doing it regularly. And you have to demonstrate regularly. That's 2A. Okay? 2B, Victor and the, who's 2B? Alfredo. Evaluate, again, the key word is evaluate. Okay, now you become the educator for yourself. So remember how your educators helped you to reflect on your visit and find the places where it was kind of mismatching, and they help you find the alternative approaches and what happened, help you process and recognize what happened in terms of implicit bias, in terms of countertransference, whatever that is, and then you reflect on it and change the course based on that reflection. And then you complete it, and then you write about that on your verbatim, and then you bring the verbatim, which is complete set, to the class. Okay? You become your own educator. That's what we mean by evaluate. That's 2B. Outcome 3. Intercultural and interreligious humility. 1A, demonstrate respect for the orienting systems of others arising out of sense of common humanity. Can you respect other orienting system? Okay. I have to chuckle. So, different culture has different respect for different kind of manners. So, for example, there's some manners of there's a meal etiquette which is very different depending on the different culture. Okay, in American culture, you're not supposed to make noise or sound while you're eating something. So you have to eat quietly. You're like, all right. In Korean culture, when you're invited to your friend's house, and then they fix this, the great meal table for you, and then when you eat so quiet, it means that you don't really enjoy the meal they fix for you. So the host expects you to eat a lot and eat with some noise, like, chop, 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 they'll make them happy. Okay, so there's different meal etiquettes, and can you respect each other orienting system in different culture? And there's so many different details. Are you ready to respect that? Even among Asian cultures, there's huge differences in different cultures. Let me give you one example. If you go to Japan, you're supposed to hold up the bowl in your hand and then eat it. Okay? And that's the etiquette. If you go to Korea, if you hold the bowl in your hand and eat it, they they laugh at you because it means that you're in a hurry. Is somebody chasing you behind? Why you eat like that? Easy, okay? You're easy. That's easy as it. It's totally opposite way. In Japan, that's respectful way to do it. Okay, in Korea, that's not respectful way. So how can you tell? You have to stay curious and then stay the patient focused. That's one of the reasons why you have to stay focused until you get it. The orienting system, their spiritual needs, and their spiritual resources. Stay focused until you get it. And until then, respect it. And then even in the United States, all different cultures depending on different families. Okay? Don't be fooled by these big categories, by races. No, there's many more details. Okay? Many, many more details. Stay curious, stay focused until you get it. So, if you think you can respect and stay focused, and you see that the power and the value of respecting others' culture and orienting system in providing care, then you met the indicator for 1A8. 1B8. Articulate, you should be able to explain how you used, okay, not just knowing, you use and practice this concept when providing spiritual care. You start using it, okay? Start using it, explain. 2A, you have to regularly practicing it and demonstrate regularly when providing spiritual care, not after, when providing spiritual care, in the middle, okay? 2B, evaluate. Okay, in the middle of the visit, you see something's going offline in this issue, and then you reflect on it and change the course and choose different intervention, and you bring the whole set as complete set to the class. All right. Category C, relational dynamics. Outcome 1, empathy. Demonstrate 1A, level 1A. Demonstrate knowledge of and initiate use of empathy. Do you know the concept? Do you know that? And do you start using it? 1A. 1B, not only using it, but you have to use it in the middle. This is what it means when providing care. And then you are able to explain why you did that, how you did it. Okay? 2A, regularly doing it and demonstrate. 2B, evaluate. Outcome 2, relational boundaries. Level 1A, demonstrate knowledge of and initiate use, start using it and knowing it. Healthy relational boundaries, spiritual care. 1B, you start using it and explain how you did it. In what context? 2A, regularly demonstrate healthy relation boundaries. Okay? 2B, evaluate. Yeah, okay, this is question. Why it is so important to draw boundaries? Anybody has some comment? Why is this so important? Drawing healthy boundaries. Can you give me some example? How you did, Kate?
I think probably burnout. And a practical example would be that we have guys in jail who leave jail and want to stay in contact with a chaplain. So we have to put pretty firm boundaries around that because Like if I have 1,800 guys in jail that I'm taking care of, I can't take care of some subset of that outside of jail. There's other resources.
Right. Good example. Very good example. Anybody else? Why is this important? And how you do it? What scenarios have you experienced in this?
While visiting
Go ahead.
somebody in NICU, our maternity, I can't remember which one, there was a sign on the door, no male caregivers or students.
Mm,
Well, that's a boundary right there.
right.
And that's a firm boundary.
Mm-hmm.
And so I checked in with the nurse
Mm-hmm.
to find out what was going on to see if a female
Mm-hmm.
chaplain would be more appropriate. But to
Mhm.
cross that boundary and assume it's my
Mhm.
floor, so I'm just going to come in, could have
Mhm.
been very off-putting.
Mhm.
So that's a firm boundary. But this one, or perhaps maybe someone who's Muslim, who really does do, my experience, do not want a man in the room without a husband, brother, or
Mhm.
someone else. That's an
Right.
important boundary
Right.
that that I've learned with maternity care is important to recognize and
Mhm.
respect and act appropriately.
Very good. That's very good example. Yeah. Not just our boundary, we draw the boundary, but also respect their boundary as well.
Mhm.
And check on it before you go in. It's very important. And then there's a sign at the doorpost of each patient's room, and there's a reason for this. So read it. And my recommendation for all of you is if you have a time, if you have a chance, I recommend you to always visit the patient room by way of the nurse station. Check with the nurses and ask, so any updates since I made a last visit with this patient, or anything that information that will be beneficial for me to know before I make a visit. It's always better for it to go by way of nurse station. Alfredo.
Yes, any time I go to the room, I ask the nurse, even though they do not have any signs,
Right.
I ask them if it's appropriate for me to
Right.
get into the room.
Yes.
And that create boundaries.
Right. Very
Yeah,
good.
you're right.
Yeah. Even if you made a visit with the patient before, even if you feel familiar with those patients, you never know what happened in between, those two visits, that end now. Okay. So it's better for you to go by way of the nurse station. And let me give you some examples about the boundaries. So this is not the hospital setting. There is a chaplain intern who was doing CP at the church. So he provided pastoral care to congregant, who was a female congregant who just got divorced and who expressed tremendous grief and anger, disillusionment, and then he did a great job of providing care to that congregant. And then there were times that she asked for some questions after the work hours, and then so they decided to share text messages. So they shared the phone numbers, and then he provided care through text messages. Okay, and then she really liked his care, and then she started asking for help for other, minor house chores and kind of stuff. And so what do you think about this? Is it healthy or no? Is it not healthy?
It's
Yeah, why
not
is it not healthy?
It's not healthy.
Yeah. Jennifer, why is it not healthy?
it's not healthy because they may end up taking the relationship to another level,
That's
which
right.
benefits
Right.
both of them.
Yeah. So if you were the chaplain, what would you might have responded differently? Jim.
My office hours
Mhm.
are this time.
Yeah.
And please respect that. And I will talk to you then.
Yeah. Yeah. How about sharing the phone numbers?
Or
What do you think about
yeah,
that?
What do I think about sharing the phone numbers?
Yeah.
I don't think it was, I mean, is it his personal and her personal phone
That's
number,
right.
cell
Their
phone?
personal number so that
Okay.
they could share text messages.
Yeah, I don't think that was, I don't know. I guess it's okay as long as it's within hours, within the office hours that
Yeah.
has been, stipulated.
Right. So, which is the recommendable, the ideal intention at the beginning. But after you share the personal phone numbers, there's no way you can stop.
Mm-hmm.
Yeah. So whenever you may have like a good ethical boundaries, but what if she wants to text you and ask questions after hours? You can't stop it. So that's why it is not recommended for you to share your personal numbers with your care recipients, period.
Mm-hmm.
Yeah. It's not recommended to
Can
share
I
your personal numbers.
pitch in?
Yeah. Yeah. And then go
Can I-
ahead.
Yeah. One of the ways that I use and then I teach previously was just say hospital policy. We're not allowed to share our information. You can reach to our spiritual care department if you want to contact me. That's policy deals.
Yes. Yeah. Very good. Just share the policies of the department. Okay.
Yes.
Instead of I don't want to share them. Don't say I don't want to share them. That's not policy.
Yeah, and sometimes when they need, we have to have resources
Uh-huh.
to guide them. Do you know, you cannot call me, but you can call this association.
Yes.
They are willing to help you
Yes.
and
Right.
do anything for you.
Yeah.
But I never share your personal phone with nobody else.
Kate, you have a comment?
Yeah, I was going to say, I think it might be a little bit different for jail because
Mhm.
part of what we try to do is restorative justice.
Mm-hmm.
So the ideal is that people go back into the community and rehabilitate with community.
Mm-hmm.
And sometimes a faith representative can be sort of a stepping stone to that.
Mm-hmm.
So it's a little more of a gray area for us. For example, someone who is in prison might come and talk at one of our volunteer seminars because we've stayed in touch.
Mm-hmm.
And it isn't necessarily centered around the chaplain.
Mm-hmm.
There are sort of fingers into the community and into the jail. So I might
Gotcha.
say it's a little more subjective
Mm-hmm.
to the chaplain because what I do is
Mm-hmm.
they do have our numbers. We do have our cards.
Mm-hmm.
And I say, I can't do anything for you outside, but if you ever want to pray with someone, you can call, leave a respectful message.
Mm-hmm.
Don't be drunk, don't be high, make sure you're really clear.
Okay.
And I will call you back and pray with you. Don't do it more than once a month or so. But if you feel like that's something that would be helpful, I will try my best to honor that if I can.
Gotcha.
Sometimes we live in that gray area.
I respect that. But Kate, is it something that your department is aware of?
Yeah, actually all of our chaplains do it, and you can kind of set your own parameters for it.
Right.
But every single one of our chaplains does in some way have
Gotcha.
outside contact. It's just a question of some people have more and some people have less.
Okay, gotcha. Yeah. This is new for me, but again, I want to respect the policy of that specific context. Mostly though, it is not recommended, but I respect that context. Okay.
Joseph, can I ask a quick clarifying question?
Yes.
So Kate, how does that line up with your, I have 1,900 on the inside, but I can't take care of, because you're definitely taking care of them.
So basically, I've only ever had 3 people actually do it, where they call, they leave a really clear message. They say, I want to pray with you, chaplain. We call, we just do a prayer on the phone. And then that's it. There's no other contact. There's no other meeting. There's no other space. It's just sometimes with addicts, they get into points where they have a directional choice.
Right.
And they link back to affirmation and connection that they made in the jail.
Right.
as part of their restoration. And it's never, I haven't yet had it go on longer than once or twice. And I'm
Mhm.
always really clear that
Mhm.
it's just really for that transition.
Mhm.
But it's very specific to the
Mhm.
context of prayer only, not ongoing dialogue.
Okay.
So you set the limit. Here you just said no more than once a month and it was open-ended. But now I'm hearing you say you put a limit even on that. It's the transition period.
Yeah, I haven't even had
about
someone
that?
call me more than twice, so I haven't actually had to say a limit, but I
Mhm.
have basically, if someone's asked in advance,
Mhm.
I'll say once a month max,
Mhm.
and then they just don't. But if it were, say, more than twice, I would
Mhm.
just say,
Mhm.
what does your community look like? How are you looking for resources in your community? Who can
Mhm.
you pray with that's outside of here? And
Right.
try to steer them away. It's just
Right.
kind of a different way of looking at the same, but
Gotcha.
here I
Do you make a report after that conversation on the phone?
Not necessarily.
Okay.
No, I think we all kind of, if there's an anomaly to it, we'd
Right.
probably discuss it at weekly
Yeah.
staff meeting.
Yeah.
But again, I've not had anybody push
Okay.
the boundary of it.
Gotcha.
Last question. So you don't make a record, does it fall under your liability coverage?
I just know that our boss is aware of it.
Okay.
And she does not oppose it, and
Right.
she's aware of how each person sets their parameters.
Mm-hmm.
So we're all in conversation about it, but my
Mhm.
point was more restorative justice is kind of a gray area of
Gotcha.
society and community connection.
So I respect the context and the need for that. And my recommendation for your kid in that context is whether it's a verbal or written, I would let your boss recognize that. Like, for example, I had a phone call from so-and-so when, and this is what we talked about. Just report it to your boss verbally, at least, okay? All right, that's my recommendation. Jim.
Yeah, so I have a confession, maybe be helpful for case
Love it.
study in this on this relational matter, but I just want to be cognizant of time. Can I share, or
Yeah, go
do we
ahead.
need to
Yes, go
move
ahead.
on? Okay, so on Tuesday, I had a resident patient come by my office looking for the social worker and asked for her number.
Mhm.
And she is now and not me being new to this context of being a full-time chaplain at this. I mean, there's a health center here, and anyway, so um, we've given our cell phone numbers for the on-call list on rotation,
Mhm.
and so when this patient came and resident came to me asking specifically for her number, I said, "Oh, let me look up her new or her extension for you." And the patient said, "I have her extension. Do you have another number for her? Because I just can't get her." And
Mhm.
I kind of had the thought like I shouldn't
Mhm.
give her.
Mhm.
And so this is my confession. I did give him her cell phone number. But I said, "You didn't get that from me." Uh, as a
No, that's the confession
and
that you
that's the confession part. So I guess I don't know. Like I
Yeah.
guess I'm
Thank you
opening
so
up
much
for
for your
discussion.
compassion. Yeah. Yeah.
I'm
Thank
not
you.
giving him my
He
phone
said,
number.
I did. Yeah, he said, "I found it on the floor then." And I said, "All right, great."
Well, here's the good news, Jim. We all make that mistakes. We all
Yeah,
do. I did too. Okay. And then after that, oops, what did I do?
yeah,
So again, that's respecting your colleague's boundary.
right,
Yeah. So it's totally up to her, and
right.
she has the choice. So the policy is okay. So I'm gonna let her know to contact you.
Yeah,
Okay. So that's. But again, um, and I shared that story between the congregant and the pastoral care pastor in the church setting. But here's a really gray area. This has really happened not many months ago by one of the students. So one of the intern chaplains went into a patient room and happened to be the patient's family was actually the family of a friend of his son's. So his son knew this family very well. So after like about 2 or 3 minutes of conversation, they started having this so many things in common. You know, the schools they went together, and then this family they who do you know him? Oh, I know him. Do you know? Oh, I know her. And they just had a long conversation, like, oh. And then they just, also give me your number. Okay, can you do that? Maybe not. Yeah, maybe not. Because let me tell you one of the reasons. I'm not talking about the lawsuit or anything. When people come to the hospital, they are in different context. They're in different mindsets. They're in different need. Because they're in different need and different mindset and different context, it means that after they come out of that context and that mindset and that health condition, you do not know what they will want or how they will do with this context and this the relationship. Okay, so that's why we want to keep it professional, keep it there in here. So when I talk about here and there are many reasons, but this is one of the reasons. So another reason is when you are so much into that kind of, rapport building and connecting with one another, you may lose your focus in providing care to their need in the moment. Okay. So for you, don't you ever forget your role in the room. Your role in the room is pastoral caregiver. So your number one concern and goal is to figure out their spiritual need and spiritual resource. Spiritual assessment is your first thing, the first mission to do. Do your spiritual assessment first and try to find out their spiritual need and spiritual resources. Then from there, you can go. And if you find that one of their spiritual needs is to reconnect and to the normalcy, and then you can say, oh, I provide this kind of conversation of connection because I see that as their need. You can say that. Or if not, pretty much you were ending up just meeting your own needs. Oh, you have met an old friend. Oh, I feel so great. I found my old friend here. So you're meeting your own needs. Does it make sense? Okay. So the same conversation can happen in the room, but whose need is being met? That's my question. So on your verbatim, your educator will continue to ask you, what is their spiritual need through your spiritual assessment? Are you meeting their need and how? If you cannot say or respond to that, probably it's possible that you are meeting your own need. Okay, so you have to focus. Don't lose your focus. It's very important for you to draw your line, boundaries. Why? For their sake. I'm talking about the lawsuits. Skip. You have some comments?
Yes. No, I did not.
Okay, all right. All right. Another common questions you may hear from the patients is that, oh, I really like your visit. I really like you. So which church you go to? Because I'm looking for a church. How would you respond? James.
Oh, I would say a lot of times, same question. I would say, this is my church. You're my church member. That's it. Yeah. They don't ask anymore.
Right. Why it's better for us not to give them our church names or location? Why? Why is it about drawing the boundaries? Why can we not just tell them which church we go to? We just help them come to our church. Why is not recommended?
It doesn't look as if we are trying to convert them to our own church.
Yeah, that's one of the reasons. Could be. Yeah. What else?
Well, it's a whole blurring of boundaries. Are they going to be able to see you as a parishioner, or are they going to continue to see you
Yes.
as a counselor? And then
Yes.
that could really be problematic. After church every Sunday, they want to give you an update.
Right.
That could not end well.
Yeah. How can you handle that? Do you want to be chaplain on Sundays?
I just usually send them to, some church nearby that's not mine.
Right.
Yeah.
Right.
No, I don't.
Yeah.
Usually, I've been asked a couple of times, but thankfully the place I serve is further away, so
Mhm.
it's not reasonable for them to drive.
Right.
But it is, from the pastoral background, it is kind of a well, we're all programmed to invite and invite and invite.
Mhm.
But that could be really and uncomfortable for them
Mhm.
when you draw the boundary firmly, and uncomfortable for you where there could be a sense of dread. Are they going to be here? Oh no.
Right.
Yeah.
Yeah.
It's
The thing.
also
Yeah. Go ahead.
professionally unethical to local ministers,
Mhm.
as we need to respect their professionalism.
Mhm.
We're not stealing people,
Mhm.
relocating people.
Right. So there's another perspective of drawing a boundary, respecting the pastor, local pastor as well. Yeah. Yeah. So again, I want you to remain in your role as a chaplain in the room as much as possible. Okay? Don't you ever forget that. Whatever comments and behaviors you provide in the room, whether it's a verbal or gesture or smiles, whatever, even comments about your church, that has to be provided for the sake of meeting their need. So that your educators will always ask you over and over again, what is your assessment about their need? Are you doing this, saying this to meet their need or not? Then whose needs are being met? Why you said that? Why you did that? Okay? That's the key. Don't lose your focus. Just stay focused. Okay. I'm not saying you're not supposed to do this way, not supposed to do that way. Whatever you say, whatever you do, we'll ask you, is this for the sake of meeting their needs? Okay. All right. Let's take a 10-minute break. We'll come back. Okay, let's regroup. For the next hour, I'll share a didactic on pastoral care responses. Okay, this is one of the essential didactics that has to do with your communication style. So this has to do with 1A13, demonstrate understanding and initiate use of communication styles and skills. And also on B13, articulate how your communication styles and skills develop spiritual care relationships. And 2A12 is about communication style. Okay. So when you try to provide an evidence for these indicators, this is what you're supposed to talk about in your indicator, tracking record indicator chart. So again, there might be all different kinds of categorizations about types of pastoral care responses, but I like this 5 types most because it's so simple and simple enough to remember. Okay, so I want you to remember these 5 types. So there's a judgmental type of communication, judgmental type of response. These are positive, negative, appropriate or not, helpful or not, effective or not. So you make the judgment for them. Okay. Instructive means to try to teach, preach, impart meaning or insight. Supportive means that you try to give comfort, encouragement, acceptance, or seek to pacify, regardless of their where they're coming from. So whether they're going to have a surgery soon, you'll say you'll be fine. Or if they have new diagnosis of cancer, you'll say it'll be okay. Okay. So it's more like the comments usually the pastors provide at local church. Developmental is the comments or responses you use to elicit more information, more data, or intend to further a discussion along a certain line. Help them say more. Empathetic means that the response communicate understanding, appreciation of feelings. Okay. So here is a good example. So if the patient says, I was so mad at my abusive dad, I had no other choice but to leave my home. It was too overwhelming, but I still feel sorry too. You could respond with judgmental statements saying, good for you. You make judgment, right? You did the right thing in leaving home. You made a judgment. Instructive, you can say, what you must have learned from this is that you exercise your agency to protect your safety. Let me teach you something. Let me tell you something. Supportive would be, don't you worry. God will work it out for good in all things. Will not worry. Don't you worry. That's supportive. Developmental means, oh, tell me more about what you mean by feeling sorry. Empathic will be, it must be very difficult for you now. You must have been furious when you had to endure your dad. Again, my recommendation for you is to start with empathy first, empathic comments. Then you move on to other comments, okay? But if you say, I found the need to offer judgmental statements, so I said this is fine, okay? But most of the times, I recommend you to start with empathic. Or some patient says, I know you may think that I'm crazy, but I see a good spirit trying to come into this room to bless me, but it is blocked by the curtain. Can you open the curtain on the window? By the way, all these comments are real comments. You can respond with judgmental statements saying, you're right to tell me there was a spirit outside trying to come in. Okay, you made a judgment, say right or wrong. Or you can say instructive. Acknowledging use of the spirit indicates that you have a power to understand what it means. Let me teach you something, remind you something. Supportively, I'm sure you will get better now that you told me that. You'll be better. You'll be all right. Developmental will be, can you tell me more about what you mean by trying to bless you? They say more. Empathy will be, you know that you're not crazy. I hear you need to reconnect to your sacredness. All right, so what if the patient says, I don't go to church anymore, the people are hypocrites, but I'm still spiritual. You will hear this comment so many times. So many times. And how you can respond? In judgmental statement, you can say, you know, I'm certain. So certain means that you made a judgment. I'm certain that isn't true. It is true, that is not true. You made a judgment for most people. Instructive will be, by the way, scripture tells us that it is important to be fellowship with others. It is really the only way to connect in worship. Let me teach you something. Supportive means, I'm sure it is not as bad as you think. Let me try to help you out here. It'll be fine. Don't you worry. Developmental would be, could you tell me more about what you mean by hypocrites? So you said people are hypocrites. Interestingly, you don't have to ask, could you tell me more, or open-ended questions to help them develop more. You just repeat what they said. So you said people are hypocrites, and then it just functions and works as a developmental thing. Empathy would be, you seem hurt and angry now. The church people have lost your trust. Okay, so you remember the empathy and sympathy? You know, this dictionary definition is, it is capacity to understand and respond to others' emotions. So it's empathy means feeling with. So this is the difference. These are the difference between empathy and sympathy. Empathy is just listening and feeling with. That's empathy, feeling with. Sympathy is give unasked advice. You get closer to them, knee to knee, and then you try to give unasked advice because you're so into, you almost become one with them. The sympathy. Okay? Empathy is like a shaking hands with them. And I feel how you feel. And sympathy is like, you're confident that I know how you feel because we become one, which is not necessarily recommended in foster care world because there's no way you know their feelings 100%. You can understand, right? So how to form empathic responses? There are some ways of forming empathic responses. The first way is called content repetition. As I said a couple of slides ago, if you don't know how to form empathic responses, just repeat what they just said. It's called the parroting. Summarize what they said and repeat. It's called content repetition or parroting. Or you can do selective response. Respond to only a part of the client's statement. It's called a selective response. Respond to part of it. Feeling reflection is just rephrasing using different words of the feeling content expressed. So it's feeling reflection. Okay. So there are mainly three ways of forming how to form empathic responses: content repetition, selective response, and feeling reflection. So for example, if patient says, have you ever had something stifle you? So you couldn't shake it loose? I have. I've got this thing inside. If I can't get it out, it's going to ruin me. The content repetition is like, you feel that you'll be ruined if you can't get out whatever is inside you, stifling you. Is that it? You just repeat the content and they respond more. So this becomes developmental. Selective response is like you just respond to part of it. So he said many things, she said many things, and just respond to part of it. So you can't shake the feelings that you'll be ruined. Just respond to that part. That's part of it. Or feeling reflection. Respond to the feeling. Another way of putting it might be you feel you just don't have the strength to shake this thing. So out of many things, just focus on the feeling that you just can't shake it off. Okay. Okay. Let's do some practice. Okay. Skip,
Yes.
can you read the first sentence and make an empathic response and an instructive response?
I will do my best. I lost my husband a year ago this Christmas. He was in here almost a month. It's hard. So very, very hard. Instructive could be, where do you think you are and what stage of grief you're experiencing?
Yeah. Okay, so that's
Instructive.
yeah, instructive in the form of open-ended question. Okay, how about empathic?
Empathic. You have lost so much. What are you feeling about that?
Okay. You have lost so much. So just part of responding to the content, okay, and also, yeah, also you added the developmental question. Say more about your feeling. Okay, good. All right. Jim, can you read the second statement and then make supportive comment and empathic comments?
My therapist suggested I come to see you. He said this was a little out of his line, and I guess I agree with him. Well, I forget how to do supportive, but empathic would definitely be something like, it's good that you're here. It's good to see you. And you listen to your therapist.
Yeah, but so that's good enough. Yeah, you just
Okay.
acknowledged. Yeah.
Yeah.
Yeah. Okay. All right.
And supportive, I mean, what is that one again? Like I know I'm trying to remember like an acronym with all the 4 or 5 different ones.
Yeah.
J.
So supportive means the response is to give comfort, encouragement, acceptance, and seek to pacify. So this is
Okay.
the example. Don't you worry, God will work it out for good in all things.
Okay.
So what would you say to this person?
It seems that you're really trying to get help.
Yeah, that's more like empathic. Supportive
Okay.
means it'll turn out so good. Everything will be all right. Don't you worry. So
Okay.
it's basically no matter what they say, the answer is always the same. It'll be all right. Don't you worry.
Okay.
That's supportive.
I guess I'm getting confused because of the like case studies yesterday was with the pregnant woman who had cancer, was just like not wanting to hear that, you know.
That's
and
right.
I feel
Exactly
like,
right. Very good, Jim. So supportive comment is not recommended.
okay.
That's very good. So judgmental, supportive, instructive, those 3 are not so much recommended. Okay. What are recommended? Empathic comments
Empathetic.
and
Okay.
developmental comments.
Okay.
Yeah, very good. Yeah, I like that. Of course not.
Yeah.
We're not supposed to say, don't you worry, it'll be fine. God is going to help no matter what. No, we're not supposed to say that.
Okay.
Okay, that's very good. Yeah. But having said that, sometimes you may see the need for them to hear that. Then you say it.
Yeah.
Okay. But it has to be based upon the appropriate spiritual assessment. Very good. Jennifer, can you read the third one and make judgmental statement and then empathic statement?
I've been talking to you for 10 weeks now, and you haven't given me any reason to go on living. Judgmental. Yes, you are right. I haven't given you any reason to go on living.
Yeah, that's judgmental. Yes, you're right. Yeah, that's judgmental. Yeah. Maybe she needed to hear that. Acknowledge. Yeah, yes, you're right. Don't go defensive. Yes, you're right. Okay, how about empathic statement?
I'm sorry to hear that.
Hmm.
That must be disheartening for you.
Yes, very good. Okay. All right. Kate, can you read the fourth one and make instructive statement and then empathic statement?
You are the most wonderful friend I have ever had. I don't know what I would do without you. You said instructive and empathetic.
Mm-hmm.
Why do you think you need to see your chaplain as your friend?
Okay. So is it instructive or empathic?
So that I was thinking was instructive.
Okay, yeah, so that's the instructive they could be seen as instructive in the form of open-ended question. What if you make instructive statement instead of question?
Okay.
Yeah. What do you want to teach her? You want to teach her something here?
Yes, I might categorize this relationship differently than you do because I see myself as your chaplain, I see myself as your chaplain more than I see myself as your friend.
Okay, yeah, so it's reframing and instructive. Yeah.
And then empathetic. I don't know what I would do. It feels so scary when we don't know what to do, doesn't
Very
it?
good, empathic. Very good. Very good. I like it. Yeah. Okay. Ram, can you read the 1, 2, 3, 4, fifth one and can make developmental and empathic?
The pain is too much that won't give me, I'm sorry, the pain is too much and they won't give me anything for it. I can't stand it anymore. What can I do?
Developmental and then empathic.
Yeah.
Were you there when I began this dialectic?
Yeah.
Okay, all right.
Okay.
So developmental is to help them process more.
Yeah. Yeah, the pain is too much. Okay. The development is so the question is, have you asked the doctor or how long have you been having this?
Yeah,
And
so you could say, how long have you had this pain?
yeah,
Yeah, then it could be developmental.
Right.
Okay, so ask the question with open-ended question, and then it'll be developmental
and it
state,
opens up.
developmental
Yeah.
question. Yes, with
Yeah.
open-ended question. And
Right.
she'll respond. Okay, how about the empathic?
I'm so sorry you're going through this pain.
Mm-hmm. Right.
And
I'm so sorry that you have to go through this pain.
I'm so sorry you're going through this. And
Mhm. Right.
I wish I could support you more.
Mm-hmm. Thank you. Right. When you're asked, somehow, you don't know how to function well. So it's easier said than done. So on your verbatims, you will be given. Oh, I'm so sorry, Audrey. I did not give you a chance. I'll go back. Let me go back. All right. Audrey, can you read the third one and make empathic comments and judgmental comments?
I've been talking to you for 10 weeks now, and you haven't given me any reason to go on living.
Judgmental statement and then empathic statement.
That's mental. Yeah, you're right. We have been talking for 10 weeks.
Yeah, it's simple. And then empathic comments.
Oh, let's see. I'm sorry to hear that you feel that way.
Mhm.
What can we do different? Or
Okay, thank you. Right. So you can say that, and then remember the three ways of this is for everybody. The three ways of forming empathic comments. Okay, one way is to reflect on the feeling. Most of you did that way, reflect on the feeling. The other way is the content repetition. Okay, so if you want to offer empathic comments using that method, you can say, right, you've been talking to me for the past 10 weeks now about the reason to go on living. Okay, by just repeating what she said, your intention of empathy is delivered only by repeating what they say, because it let them know that you're hearing and you're interested in what they say, only by repeating the contents. Or you could just respond to as a part of what they said. I hear you. You're trying to find a reason to go on living. You all need a reason to go on living. Okay, see how you form empathic comments? So think about this, the three ways, not just reflect on their feeling, also repeat the contents and respond to a certain part. Okay, the three ways. Okay, now let's go back to that conversation that I showed you yesterday and then see how well the chaplain did in terms of communication style. Okay, remember this? 30-year-old female patient being pregnant, but newly diagnosed with cancer, ovarian cancer. The chaplain went in and the conversation was going off. Okay, remember this? Chaplain 1 said, hi. Are you Maria? Yes, I'm Peter, the chaplain here at the hospital. I just wanted to check in and see how you're doing. Patient, I don't know. Not great, obviously. C5, look at C5. Right, yeah, it must be hard being sick and pregnant at the same time. Okay, so what kind of response, what type of response did he make?
Weakly empathetic.
Yeah, that's right, weakly empathetic. Must be hard being sick and pregnant at the same time. P6, I just found out it's ovarian cancer. I'm pregnant. I have a 4-year-old at home. This wasn't supposed to happen. And C7, yeah, cancer is bad. So what statement is that? What type of statement is that? Yeah, cancer is bad.
Judgmental.
Yeah, judgmental. You're right. Cancer is bad. Okay. But there are treatments now. Okay. What statement is this?
Supportive.
Instructive.
Instructive. Yeah, let me tell you something, but there are statements that don't forget that there are treatments now. Let me teach you something. You are just got to stay strong for your kids. What statement is this? What?
Supportive.
Supportive means you'll be fine. Everything will be okay.
Judgmental.
Yes, this kind of judgment is more like instructive. Yeah. Let me teach you something. Don't forget that you just got to stay strong for your kids. You need to know. Okay? Judgmental is you're right, you're wrong, this is bad, this is good. P8, I don't need a pep talk. I'm terrified. I don't even know if the baby will be okay. C9, oh, sorry, I didn't mean to. Okay. This is apology, right? Are you religious? What kind of statement is this?
Starting developmental. Are you religious?
Right. It's a developmental. Yeah. Yeah. But at the same time, judgmental.
Judgmental.
Yes. It's making judgment. Maybe you're not religious enough. Making judgment. Maybe you could pray about it. It's still judgmental. It's because you didn't pray enough. Because you're not religious enough. P10, I pray all the time, but I don't hear anything bad. C11, maybe God is testing your faith. What kind of statement is this? Type of statement? Judgmental.
Yeah.
And instructive. Yeah. Let me teach you something. God is testing your faith and judgmental. Your faith is not good enough, so God is testing. P12, that's not what I need right now. You're not giving me what I want. You keep judging me and then instructing me. C13, I'm really sorry. I didn't mean to upset you. Okay? Apologies. P14, I just don't want to die and leave my son, and I don't know how to go through chemo and pregnancy alone. C15, that sounds really scary. What statement is this?
Empathic.
Empathic, right. Thank you for sharing that with me. I can imagine what it's like. What statement is this?
Diplomatic.
Diplomatic? Yeah. It's, I can't imagine what it's like. It's empathic, right?
Perfect.
Yeah, very good. I just want someone to say this sucks and be here. And C17, this is very interesting. What type of response is this, C17?
Supportive.
Supportive is everything will be fine. You'll be okay. Yeah, it's always say everything will be okay. There's no problem. That's supportive.
Okay.
So I just want someone to say this sucks.
Well, he repeats it, so it starts as a form of empathy.
That's right. That's right. Yes, it's a form of empathy, but the content is
Developmental.
yeah, because repeats it, so it repeats so that she can
Parroting.
also talk more, right? And then yeah, you're all right. There's another category. She's making what for the patient? She's making judgment. Yes, you're right. This sucks. Sometimes judgmental statement is okay, is needed because that's what she wants. I just want someone to say this sucks to make the judgment for me. Yes, this sucks. So C17, he said, yes, this sucks, Maria. And I'm here. Okay, that's empathic. I don't know how to fix it, but I can sit with you. Very empathetic. Okay. See how the communication style goes? Okay. And your educator will continue to ask you what type of pastoral care statements did you use? And then by the end of the class, you'll figure out that, oh, this is my style. Much more than I thought, I use more judgmental statements. Much more than I thought, I use more instructive statements. Much more than I thought, I'm using empathy statements or supportive. I have seen intern chaplains who pretty much come from local church pastor ministry. They tend to say more of supportive comments. Even before they figure out the spiritual needs of the patient, they just say, you'll be fine, you'll be all right. Don't you worry. I pray for you. Okay. Before you get there, think about the spiritual needs of the patient. Okay. Regardless of their needs, regardless of their diagnosis, regardless of their context, I have seen pastors saying supportive because they want to support anyway. They just say, okay, it'll be fine. Don't you worry. It'll be all right. Everything will be fine. That's supportive. You want to support, but do you know what? Many times they do not want to hear the support comments. First, they want to let you hear their pain. They want to let you make judgment for them and agree with them because they're in such a great pain. They feel it sucks. They want you to agree with them and say it sucks instead of saying everything will be fine. Okay. This will be one of the key practices and skill sets for level 1A and level 1B. Okay, level 1A, level 1B, your educators will continue to ask you, do you recognize your communication style? Why you use this type instead of empathy? Why use judgmental? Why use instructive instead of empathy? Okay. Comments, thoughts? Jim, seems like you have some question.
I know nothing really. I was just deep in thought. Just thinking about scripture, Jesus wept, and Mary Magdalene, and you know, I don't know. Maybe we shouldn't go there. I'm just kind of like I'm just thinking. I'm so much of my. I mean, what you're saying is contextual. But in a lot of my context, there are people weeping, and I'm trying. You know, I don't. I'm trying. I was just thinking about at what point am I judging myself on being so desensitized to not weeping with them, or the expectation to weep?
Very good question. Very good question.
You know, and that I'm not, you know, I'm not meeting the expectation of the care provider or the one needing care the way they want me to in that moment, you know. When they're wanting someone to weep and I just authentically cannot because I didn't know the person.
Yeah.
I don't know. That's in a nutshell what I was thinking about.
Very good comment. Very good question. Any responses?
Not necessarily to Jim, though. I think that's certainly, I think Gaddis getting in touch with your empathy. Once you connect with your empathy, you will find a connection with her to be able to weep or feel with her. my thought was more, I think Western church, the way we all had education, we are wired to be judgmental, to instruct and offer shallow support. I think at least I did. I came up thinking that was the right way to do. What was underdeveloped was empathy, and a sense of understanding. Where are they now? Where do they want to get to as they understand their own self-identity? I think the first three we're all just raised with that.
Good. Yeah, good comments. Anybody else? How would you like to respond to Jim's question? That's very valid question, though, by the way.
You know, I have a thought, and I thought of it earlier when we were talking about the scenario where the person says, could you open the curtain? There's a spirit outside.
Mm.
And I think Jim's point is a really good one, that we're talking a lot about verbal responses,
Mhm.
but there's also a physicality to
Yes.
our presence in a space. You touched on it with the eye contact and the positional stuff.
Mhm.
But I was just thinking with the curtain example, which is where it came into my mind, that there is a posture of physical humility.
Yes.
Or in jail, for example, if I see someone struggling, I say, just go ahead and put your fist on the table so I know to put my fist against it just for a minute, and we can pause talking, like a touch thing. And I think Jim's body and tears in a way is like that. Even if tears aren't necessarily coming, there's still a way that we hold ourselves physically in a space where people are grieving, respectful, which I have no doubt that Jim does beautifully, but that it actually matters too, sometimes as much, if not more than words. I come from a physical therapy background, so I tend to think like this.
Great connection and recognition of different way of expressing your empathy. That's wonderful to recognize, Ken. Okay. Anybody else? How would you like to respond to Jim's valid question?
Can I add something here? Because we are in a virtual meeting, sometimes it's very difficult, I guess, to connect one another. And maybe based on Keith, your comments, body language, when someone shares like a Jim, we touch our heart. Oh, that's really resonating in my heart. It's showing through nonverbal cue that we can join in their feelings. Sometimes you don't know how to say it. Oh, you just touch my body. That's kind of what I recommended.
Thank you. Thank you. Yeah. So, Jim, I hear a lot of willingness to connect to those who are in need, especially those who are going through the process of grieving. And of course, there's a great need to connect for them and offer your connection through weeping, through physical support in different manners. And then on the other hand, in addition to that, I also want to suggest the diversity in the need of your care recipient as they go through their grief and loss and different kinds of suffering. For example, let's say there's a patient family who has come into the room and sit in front of the loved one declining. Okay, you may think and then validly recognize their need to weep, so you can try to connect and support, right? But in reality, there might be more diverse needs in them. For example, those people who go through this the grief, some people might be in the stage of denial. Some people might be in the stage of anger. Some people might be in the stage of depression or sadness, or sometimes bargaining. So our role as a pastoral caregiver is to be very sensitive about where they are in the moment. Sometimes we're surprised to find out that They're not really weeping. They want to express their anger toward God or to anybody. Then our role is to connect to their anger instead of sadness. Sometimes when they're in the denial, our role is to recognize their denial and sit there. Sometimes when they are bargaining, our role is to not to try to instruct them and try to get out of that, but just sit there together and listen to their bargaining. And there's a beautiful example of Jesus providing care, not trying to fix anything, not trying to provide anything, not trying to change their mind anything. They just stay there all the way through, not divulging who he was. Just sit there and walk through. Jesus didn't even tell them that he was Jesus. And Jesus was walking with his two disciples of Jesus who were such a loss. Remember two disciples walking to Emmaus after they saw Jesus die on the cross. They might have gone through denial, anger, bargaining, depression. Jesus did not try to do anything, try to teach them anything. Just walked through and waited and accompanied them as they were going through different stages. That might be our role as a caregiver. Instead of assuming what they're going through right now.
Yeah, can I say something?
Alfredo.
Yes, I have a kind of a strange experience. I went to CCU, and there is a man with his head laid down in the bed, with in the middle of his hands, and his wife is in a CCU.
Mm-hmm.
She's intubated, and I just step in front of the door,
Mm-hmm.
and he looked at me and he asked me, "What do you want?"
Mm-hmm.
And I say, "I'm the chaplain." Mm-hmm. And he answered me, do you see that I'm big with my wife right now? And I just say, "I'm sorry."
Mm-hmm.
And I give it to him and respect his space because he was pre-grip his wife and the stage. Sometimes empathy is don't do nothing, don't say nothing. Give it to the people the space, respect the way they are grieving their loved ones. And I just say, "I'm sorry," and I let them there. Because most of the time we try to fix the things, to rescue them. And that is not a chaplain's role.
Right.
You have to discern, I understand he was in his space and I invite, he looked at me like intruder into his space. So I kindly step out and let him grieve his wife, pre-grieve his wife.
Thank you for sharing, Alfredo. Yeah. Okay. So I see, Jim, you still have questions.
No, I don't.
Yeah.
This is all helpful.
Yeah. So we're on the journey. So CP's process, and then you'll hear this phrase over and over again, trust the process.
Yeah, I was just thinking about the word conduit. Like, I just feel like that word came to mind, like, just we are being a conduit.
Yes.
For the bereaved, and whatever means necessary, that in that context.
Yeah.
Am I understanding that to be?
Yeah, I think that's a nice way to put it. And then we, even today, after 27 years of pastoral care ministry, even today, I struggle with myself between to be the rescuer or to be the conduit, as you said, and remain as the companion and keep checking on them and try to assess where they are, because they keep changing in terms of their need. Sometimes they're really mad in the morning. In the afternoon, they're sad. They're looking for you. But you cannot say, why did you do that? Because we're there for them. They're not there for us. We'll share the space with them, and we become the conduit, as you said, Jim, which takes a lot of practice, and continual struggle between we becoming the Superman or the conduit. But good. Thank you so much for your confession, Jim.
Yeah, right.
I see that you're so transparent, which is great aptitude to make you a good job. Yeah. You cannot tell a lie about where you are. You just keep walking and trust the process. Any other comments? Donna, you have some comment?
Just being a conduit.
Yeah, I like the way you put it. Okay. Okie doke. Let's take a 12-minute break. We'll come back for James. Okay, James, it's your time. Let's regroup, guys.
Is it James or is it spiritual assessment? Sorry. Is it James or is it spiritual assessment, or did we switch it?
Oh, I'm sorry. I'm sorry. I'm sorry. I was confused. It's you, Donna.
Okay.
Yeah, it's you. Sorry about that. Let's go.
Okay, no problem.
Sorry.
Okay, James?
Okay, I think James is not listening.
Oh,
I think he has some audio issues, I think.
okay,
Yeah.
maybe, okay. Okay, so we're gonna talk about spiritual assessment. My eyes are really bothering me, so I apologize. I'm trying to look away from the screen and going back and forth with glasses, so I apologize. So spiritual assessment. Let's start with the definition. What is it and why do you love it so much? Thank you, Ram. Take the jokes wherever I can get them. What is spiritual assessment?
Well, it's a way to understand another person in terms of what is or not available for that person to be supported.
Okay.
It's kind
Okay.
of doing like a gap analysis in a sense.
Okay.
How is the person is? What is he or she content with? What is he or she are they lacking?
Okay. I like that. Okay. That's helpful.
Yeah.
And it's very succinct too. Okay. So I'm gonna try to find this image, and I'm gonna end up using Word because I'm struggling to get the PowerPoint to work. So bear with me for a second. See if I can do this. I feel like a dinosaur. Okay. So can you see that screen? Is it too large? Is it okay? It's blank, right?
It's coming up. Yeah. You
Okay.
have to scroll up a bit. I think the next page is.
Scroll up a bit. Okay. So thank you. And then I'll adjust the site. So I want to suggest that this is a real helpful image of spiritual assessment. So I can see you guys. So is it large enough? Good. Oops. Good.
Yes, it's great.
Gallery. Now I don't see it. Declare. Really feel like a dinosaur. Why can I not figure this out? I have to trust the process. Okay. Let me see if I put you on the side.
Is it your dial-up access? Maybe.
Could be. It could be. All right. You're still able to see the screen and the size is fine, or do I need
Yes.
adjustments? And I'm open to all suggestions. If you're like, no, let me help you because this isn't working for us. Please.
Ahmed, let me interject. Do you have two tabs at the top of your Zoom? One says meeting and one says Donna Allen screen.
Are you asking me? Or are you telling me I do?
No,
Okay.
I'm asking because
I
we do, and we can jump back and forth between looking at your screen and looking at you. You might be able to do the same.
So if I hit my screen, I'll be able to see what you see.
Yeah, we'll see what you're presenting and you'll see it too. And then if you go to meeting, you'll see all of our faces and the pinned person talking.
Okay, and I won't necessarily see what I'm presenting in that.
Yes.
Okay, that's helpful. Thank you. So right now, what you're seeing is what I'm presenting. Correct? Okay.
Yeah.
And me.
That's a screen on, yeah.
Wow. Okay, I'm going to stay right there. So this image that we see, thank you, Kate, is I think a good image for assessment. Because I don't know about you, but for me as a chaplain, when I thought about assessment, it always felt like a burden. Like, oh, I got to walk in here and figure everything out. right? I got to figure out what the spiritual crisis is. What's the spiritual need? What's the right intervention? What's the interreligious, intercultural posture I want to have? What's my biases I need to get rid of? What kind of response? I can't be judgmental. I don't want to be supportive. I want to be empathetic. What's the right, on and on and on. So for me, assessment became like this burden. I got to figure all this stuff out. So this image is so helpful to simply sit beside. And it really works for assessment because the word assessment, and you're seeing the next screen, right? The word is the screen. I know it's a Word document. Don't laugh at me. The word assessment comes from the Latin term, which means to sit beside, to sit beside. Now, there is another derivation to this term that I'm happy to share with you if you ask me. But that Latin term, that's the root of the word assessment, is to sit beside. So in chaplaincy, spiritual assessment, as it says, is about adopting this posture of sitting beside. I often use the language, come alongside. Come alongside those we serve with presence, attentive listening, and meaning making. And I sometimes use the term co-journeying. It's technically not a word, but I use that. Okay. So the image of assessment, as opposed to I got to figure all this stuff out, what I have to do is sit beside the person. And what unfolds will be relational, it will be pastoral or spiritual, it'll center around presence, and it'll be a moment of integration. And what do I mean by that? When I sit beside someone, it's relational. Just as that image suggests, I'm not standing over them, both literally and figuratively. I'm not over them giving judgment. I'm drawing near to them, more like shoulder to shoulder. And I'm drawing near to them with empathy and attention. So it's very relational. Sitting beside that pastoral or spiritual resonance, I'm going to sit beside you. I want to share space, and we figure out what the appropriate boundary is. I want to slow down enough to notice what matters most to you, to the one I'm coming beside. I want to honor the sacredness of their story. I'm just coming alongside them. And the presence to sit beside reminds us that assessment begins not with a checklist, not with a series of questions, but it begins with presence. I show up with being close enough to listen, close enough to observe, close enough to accompany, focus enough to listen, focused enough to observe, focus enough to accompany. Presence, real presence. And then it's integrative in the sense that the spiritual assessment is not about inspection from a distance, but it's intentionally sort of drawing close with this person and using my sense of discerning with them. Hey, what gives life here? What gives meaning? What gives celebration? What gives hope? I'm discerning that with them, figuring it out with them as I come alongside. I don't have to know. I just have to first show. Just show up and get close. Okay. All right. So we talk about the existential needs. And so I just want to define it because we use that term. And I just want to have a sense that we're using it and what I mean by it when I use the term. So existential needs are sort of those deep questions and longings that people carry about meaning, purpose, freedom, suffering, and mortality. I never come along by someone and say, let's have an existential conversation. But really, that's what we're doing. And particularly in a situation of crisis or transition or some sort of limitations, these are the things that people are thinking about. So the examples include meaning making. And I might ask questions like, why is this happening to me? I'm trying to make meaning. And by me in that instance, I mean the care receiver. So the care receiver might ask, why is this happening to me? Or what does my life add up to? They're just trying to make meaning. Purpose. Do I still matter if I can't do what I used to do? Do I still matter in light of this, that, or the other? Purpose. What's my purpose? Freedom and control. How much choice do I really have in this situation? I have ovarian cancer and I'm pregnant. How much choice do I really have? Suffering, is there any value in my pain, or is it just pointless? And then mortality, what happens after death? Or will I be remembered, or will I survive? Those questions come up. So that's the existential conversation I'm having as I'm just coming alongside someone. Again, not using the term existential, but listening for those questions that they're raising. So why does spiritual assessment matter? First of all, it guides the chaplain's interventions in ways that are sensitive and appropriate. And so if we're not doing some sort of intentional assessment, coming aside, observing, listening, paying close attention, we may just do what we feel like. We may just respond to the situation out of our lived experience instead of the lived experience of the person in front of us. So assessment matters because it gives the chaplain interventions in ways that are sensitive and appropriate. That's why you often say, what was the need? Before you figure out what to do, assess what the need is and respond to the need. Maybe not how I feel, but respond to the need. Spiritual assessments matters because it provides language for charting. It's real practical, for reporting, for sharing with interdisciplinary colleagues and community partners. We have a unique language for our unique profession, and it's professional for us to be able to chart. And so spiritual assessment helps us chart. So you say more than, I showed up and prayed. You use language in your charting and your accountability and your communication with your colleagues that reflects your assessment, discernment of the spiritual need and an intervention that you used for that need and how you determined its effectiveness. So it helps us communicate with our colleagues about what we're doing. Spiritual assessment helps clarify spiritual resources, distress, meaning-making patterns, and coping strategies. The fact that I'm listening to, oh, they're asking meaning-making questions. What's my empathetic response here? How am I going to be supportive? Allows me to clarify the spiritual resources. Clarify what this distress means to them, not what it means to me. Clarify their coping strategies. One of my experiences I remember just when I was in a mental health unit, I'm not on mental health units now, and I asked the young man to talk to me about his coping strategies. And I did literally use the language coping strategies. And he said, yes, every day I have a libation at the end of the day. And that really, helps me. And I was like, okay, libation. So in my mind, libation is something you do in a ritual to honor ancestors. And it often includes liquids, right? It could be water, it could be all sorts of things, but that's not what libation was for him. And so as he kept talking, I realized he was talking about he drinks alcohol at the end of his day. That's how he survives. And I kept being curious, not judgmental, just curious, and learned how much he drinks. And then I'm like, wow, there's something else going on here. So just following his coping strategies so it could clarify what kind of resources would be helpful for him. Okay, he didn't look like he needed some insight about alcoholism. It wasn't in his chart, wasn't on the medical record. But as he talked about his coping strategies, it became apparent that alcohol was one of his major coping mechanisms, and he really wanted to do something different. Why spiritual assessment matters? Finally, it strengthens our professional identity as chaplains, as spiritual care providers. We have a unique lens. It goes across diverse settings, whatever setting you're in. And by doing the ability to do a spiritual assessment is a professional skill you acquire as a chaplain. Often in board certification, they will ask you to make a distinction between spiritual assessment, spiritual survey, spiritual history. It's also one of your competencies. So real quick, what's a spiritual assessment? Anybody? What's a spiritual assessment? I have just been doing all this talking about spiritual assessment.
Coming alongside.
It's coming alongside the care recipient. Very good. What's a spiritual survey? What's a spiritual history? And that's why board certification asks you to be able to make a distinction, because you're like, well, they're all pretty much coming alongside, aren't they? All right, so let's have some real quick definition so you get this. Spiritual assessment, it's a comprehensive coming alongside, a comprehensive process used professionally by chaplains to discern and interpret the spiritual, emotional, existential, and relational needs and strengths of a person or community. It goes beyond information gathering. It explores how spirituality functions in the current situation. It determines a need. Sometimes we call that a crisis, spiritual, emotional. And then it develops an intervention based on that need and says, hey, was it effective? So those are the components of a spiritual assessment. Dr. Donna, yes, I'll send you this document. Yes, absolutely. So that's the components of a spiritual assessment. That's the assessment. And it's what the chaplain is able to do uniquely. The survey, it's real quick. That's the thing to remember. It's surface level, it's real short. Sometimes it's just a couple of questions and you just check them off. Do you have any spiritual concerns? Do you have a particular faith or spiritual practice? It's a checklist, very quick. And then the history, that's more structured questions, but those structured questions are not to get at an intervention. Those structured questions are to simply get background information. That's the focus. What's your beliefs? What's your practice? And how's it going to impact you being here, whatever your current situation? And sometimes that latter, is it supportive, is the way it's asked. Is it supportive for you right now? And you say, yes, good. You say no. Okay, well, then we won't explore that any further with you, right? So it's just get the background information. All right, so you have a difference between, I'm sorry, I don't know why I have an echo. It's probably something I have going on, but so you have the difference between survey, assessment, and history. So let's just do a real quick quiz. Help me.
So, Donna, can I ask a question?
You sure can.
Thank you. So in the situation in the jails, since we have a very long-term relationship with the inmates,
Mhm.
I feel like we are constantly going through all three of them on a fairly regular basis.
Makes sense.
They are continuous as more process than a fixed definitions.
For board certification, you need to understand the distinction between the three parts of what you're calling a process.
Right.
Reality is, in many settings, the survey actually needs to be updated because someone may come in and say, I'm Christian, but then in further conversation, it turns out they're actually something else. But they didn't want to say that because in the survey moment, they felt it was not appropriate or not safe.
Right.
Or they are something else, right?
Yeah.
Yeah, I can understand it being a process of ongoing work. Good, very good. So in light of that question, this quiz is really easy. So jump in, please. Somebody take number one. Read it and make a guess. Is it a survey, a history, or an assessment? Thank you, Jennifer. I appreciate it. You raised your hand. Number one, Jennifer.
It's too tiny, though. I don't know if I can see it.
Oh,
An intake. Okay.
too big.
An intake clerk asks, do you have faith? I can't see it. I'm sorry. Okay,
Okay.
faith tradition or spiritual practice.
Very good. That's what the intake clerk asks. Is that a spiritual survey, a spiritual history, or a spiritual assessment?
Is that a spiritual survey or history?
Very good. It's either a survey or a history. It's a survey. That's all they ask. Do you got a faith tradition or spiritual practice? And it's an intake clerk. Good. Number two. Is that big enough for you all to see?
Yes.
I'll take it.
Thank you.
A physician uses the FICA tool to ask, are you part of a spiritual or faith community? Is it supportive? That would be Well, let's see, you said that a two. Would that be an assessment?
Very good. That's the history. The physician
Okay.
FICA is a tool. I'll make sure it's defined later. But yes, that's the history. The physician wants to know, do you got a faith community? Is it helpful? And they'll say yeah or no.
Okay, I think that FICA threw me off.
I can understand that. Number 3.
A chaplain notices that a patient's anxiety increases when they talk about family. The chaplain develops an intervention to explore this and later evaluates whether it helped reduce stress. That seems like an assessment.
Absolutely. So spiritual assessment is the bread and butter of a professional chaplain. There's no need in having you in the hospital if you don't know how to do a spiritual assessment. That's the mindset in a hospital setting. That might not be the mindset in other settings, but it's the bread and butter of the chaplain, of why you want a chaplain, because they are going to understand what the crisis situation is and what's the appropriate intervention, and then they're going to assess if it worked. So very good. You got it. Yes, Skip.
Well, that seems like more an emotional assessment than spiritual.
No, it's assessment.
Just
you put
assessment.
whatever, yeah. You can say spiritual or you can say emotional, whichever. They fall in the similar thing. So I describe myself when people say, well, what is a chaplain? I'm here to offer spiritual and or emotional support, because spiritual may not resonate with someone. And of course, we come alongside people who may not be of any particular faith tradition, and the word spiritual doesn't resonate with them at all. So it may also just be emotional support. Great. I think thank you for saying that. So spiritual assessment, this notion of to sit beside, is critical to understanding what it is. Here's some frameworks. One is called the HOPE model, and everybody has an acronym to help you remember it when you go in the room. This is Alfredo's. HOPE. So when you're having that conversation, coming alongside that person, you don't necessarily have a piece of paper filling it out, but you're thinking towards what are their sources of hope, meaning, comfort, strength. O, what is the role of organized religion in their life? P, are there personal spirituality and or practices? E, what's the effects on their care or end of life issues of so you're sort of keeping that in mind. Where's the hope? Okay, that's one model. FICA, which threw Audrey off. Hey, there it is, FICA spiritual history tool. And it's FICA because they wanted to have F for faith or belief. You ask questions about that. Do you have spiritual beliefs that help you cope, right? Survey, I would just stop. Do you got spiritual beliefs? I'm taking a little further. Do you have spiritual beliefs that help you cope with whatever this particular stress or scenario might be? Importance. What's the role of it in your decision makings, your existential questions? Community. Are you connected? And then A, how is this going to be addressed in your care? So you can see how each of the components are falling out. I'm not going to explore any of the other models, but I want you to have the traditional models that people refer to. This one is called the 7x7 model, and there's 7 dimensions that are explored. And so you'll have that in your handout. And I include the questions that come with it. Another one is narrative and cultural identity approaches. It's a more contemporary model. And the assessment and the meaning-making approach is all about the person's story, all about telling stories, and traditions and shaping meaning. And they talk about all sorts of things. So it's a narrative and cultural. So those are good approaches. And the best approach happens to be called Live Squared, right? Live Squared. And that one is a womanist spiritual assessment model developed by yours truly. So many copies when it was published. Sold none. But anyway, so this is a model that I used after the scenario I'm getting ready to share with you. I developed the model after this visit that we have. And so Liv, please, Kate.
Just kind of at a superficial level, is there sort of a rule of thumb for how you think about which to apply when? Or is this just something that is unique to each of us over time as we get better at this?
I apologize, the phone is ringing in the office. I want to encourage you, I'm trying to model, I want to encourage you to create your own. And you may draw on bits and pieces from others, and then there are some things that you uniquely have determined from your setting, I need this in here. And then you get an acronym and publish it and create your own. So there, and I want to invite, Kate, may I say something about the way you framed the question?
Yes.
Okay, it's constructive feedback.
Okay.
I want to encourage you to explore the meaning of that term rule of thumb. My recollection is it's embedded in the context of abuse of women, that the husband could go before the court and he would not be found guilty for beating the wife as long as what he beat her with was not larger than the thickness of his thumb. I could be wrong, but that's my recollection. I just want to encourage you to explore it. All right. So let's look at this fabulous model just a little bit closer. I'm also sending it to you. So I'm introducing it in this handout in great detail, and there's no need of me reading the whole thing to you. But at the heart of it is debunk, unmask, disentangle emancipatory praxis. That is the form, the guiding theme and focus of my work as an educator. I'm always debunking, unmasking, disentangling towards some liberating action, praxis, liberating action. And so the highlights of it are presence, obviously, intervention, liberation as a core practice of chaplaincy. And it's not about judgment, but about accompanying care recipients. For me, it's not about judging students, it's about accompanying students on the educational journey. So at the center of it is truth-telling and how do we flourish. So that's a short statement of this model, which I include, and I give you all the questions. I'm only going to do presence. I'm not going to do LI. I'll give you all of them, but I'm only going to read this one. Presence, presence, presence. It's critical. So be fully present. Come alongside, not above. Ground the encounter in your attentive presence. Embody presence and being in the moment. You breathe, you take a deep breath, you're in whatever physical setting that is appropriate for your context, and you own that space. And whatever is appropriate for eye contact and physical distance and all of that. Create the conditions where the care recipient feels safe to share. It's trauma-informed care. Even in this initial coming beside you, I want make sure you feel safe to share. I may need to close a door, open a door, whatever the setting requires. Invite an observer or not. Extended invitation into their truth-telling, not your interpretation. So I extend the invitation in all sorts of ways. I'm in a whole lot of pain. Wow. Want to say more about it? That's an invitation to their truth-telling about their pain, not my interpretation of it. Just extended the invitation. And understand, you extend the invitation, there's the possibility, right, that they might reject it, which would be so helpful. So sample questions, would it help if I sat with you for a moment before we talked, creating that safe space, inviting them into the conversation? What feels most important for me to hear right now? Bringing them to the current context. What do you want to hear from me? How is it for you to have me here with you in this moment, right? I'm constantly making sure they're feeling safe and okay. So this presence. I want to insert a real quick example here. It's based on Skip's question yesterday. So if I'm attentive to trauma-informed care and I come in a setting where my visit is going to be very brief, the patient or person I'm interacting with may be visibly upset. I'm clear they're having a very traumatic response to whatever is unfolding. It's not even apparent to me what has them upset to this degree. And so I'm coming alongside them. I'm going to inquire about what's going on. And they may begin to talk out of their trauma and say, and they're breathing deep and heavily and maybe beginning to sweat profusely. I'm just remembering my uncle who was so abusive to me when I was young. He used to yell and scream at me all the time. Wow, talking to, that's difficult. Can you tell me, now I'm going to ground them in the moment. I don't have a lot of time with them. Can you tell me what's bringing that up for you now? Do you know? And they may say, well, that nurse talks to me like my uncle. That social worker came at me like my uncle. The person the cop has on the same cologne as my uncle, whatever it might be. Wow. So I realize you're identifying a trigger here, something that's reminded you of this past experience. Yeah, it's just all coming back and da 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 da. Well, I'm noticing you're breathing really heavy. Can we do a little breathing exercise? So I'm inviting them to the breathing exercise. I know I'm not going to plunge deep into this moment of triggering a traumatic event for them, but I'm coming along with them. I'm acknowledging it. I'm helping them name it as trigger. I might not use that word, actually. I would say something more like you're making a connection. I might even say, well, what would be most helpful right now after I've done the breathing exercise to ground them? And they might say, I want to talk a little more. I often say, well, how can I support you? And they'll say, no, you just did. 50% of the time they say you just did. And the other 50% of the time they say, can we keep talking? So that's trauma-informed care. I don't have a lot of time, but I've already imparted some intervention in that moment. Skip.
Thank you. That is so helpful. You're getting value. You're making the most of your availability of what they want to explore, but you're doing it in a way that's not over-promising care. That, well, I'll see you tomorrow. Well, you don't know that you will. That's excellent. Thank you.
Thank you. It was a great question. So the rest of the stuff is in there. I'm not going to read it. I'm giving it to you. Just read it. You want to know how I do what I do now, but not how I did what I did for this scenario. So, and your outcomes are listed. So let's do this verbatim. And in transparency, I'm the chaplain. This happened pretty early in my experience as a chaplain. I'm going to read the part of the patient, okay? Because I just want to deliver it. I need a charge nurse. Someone volunteer to be charge nurse. And when you get to that part, would you read it? Charge nurse.
I'll be charge nurse.
Thank you. Audrey's the charge nurse. And I need someone to be the patient, Michael.
I can be the patient.
Thank you. Jennifer's the patient, Michael. And what I want you to do is count and notice the number. It's not traditional verbatim numbering. Every time I, as the chaplain, come alongside this patient who we're calling Michael. And I feel, if you were to ask me to check in, I feel anxious. I feel nervous. This feels vulnerable for me to share this encounter, but I think it's helpful. So I note that. So I want you to count. Alfredo, I'm going to ask you, how many times did you count and write down the number when I came alongside Michael? Okay, so Michael, background, again, not his real name, African-American male in his mid-30s, currently unhoused. He was admitted to the locked behavioral health unit 3 weeks ago after a psychiatric crisis in the community. This is his first psychiatric hospitalization, and he carries a diagnosis of schizoaffective disorder, depressive type. At admission, Michael was minimally verbal. He is the only African-American patient on the unit. Among the staff, all the physicians, nurses, and occupational therapists are white. The chaplain is me, African-American, my mid-40s, and I'm the only African-American he's encountered in the hospital. So over the course of his stay, Michael has become more interactive with his peers. He's become more interactive with his peers. He began attending groups, and he established a consistent pastoral relationship with the chaplain. We met every day, sometimes more than once. We're in the common area of the behavioral health unit. This is the day before his discharge. And again, it's not traditional verbatim numbering, but write down each time I come alongside. Go, number one, you came alongside. Who will read the parentheses?
I can do that.
Thank you. You're first.
Chaplain enters with a quick, light step, smiling broadly, voice upbeat.
Did we get a chaplain? I know I'm Michael. Did I ask for somebody to be the chaplain? Was it Jennifer?
I thought I'm Michael, but it's okay. I can do.
No, Jennifer, I don't think you want to be Michael. You be the chaplain.
Okay. Hi, Michael. I hear you are being discharged tomorrow. That's wonderful news.
Flat voice, gaze down.
Yeah.
Still animated, almost hyper, claps hands together lightly.
Way to go, Michael. This is such good news.
Grunts, minimal response.
Yeah.
Leans in slightly, voice warm and bright, hands clasped.
I am so happy for you, Michael.
Shrugs, voice quiet, expression flat.
Would you like to talk a bit?
Gestures towards a quieter sitting area. Michael nods faintly, follows. Chaplain sitting, tone still enthusiastic, smiling.
I just can't tell you how excited I am about your discharge tomorrow. This is such a big step forward.
Suddenly firmer, voice low but intense.
I don't want to leave.
Blinks, still upbeat, almost brushing past.
Oh, come on, Michael. You've worked so hard. This is freedom.
Voice rising, fists clenching.
You're not listening.
Leaning in, voice pushing cheerfully.
But Michael, you are free now.
Stands up quickly, yelling, face tight with anger.
You're not motherfucking listening. Nobody fucking listens.
Startled, soft voice.
I'm sorry, I will listen.
Stands up, shoulders tense, voice sharp, shaking his head side to side, rejecting.
No, it's too damn late now.
Yell.
Shut up.
Walks quickly to his room, both fists pressed against his forehead, shoulders hunched. Chaplain exits the unit slowly, stopping to speak to the incoming charge nurse, voice calm but concerned.
If Michael wants to talk later, please page me. I will come back. He is very angry.
Shaking head slightly, tone of disbelief.
Michael is angry, really angry. Really angry?
Nodding firmly.
He is very angry. No matter how late it is, I will come if he wants to talk.
Steady, reassuring.
He's my patient tonight. I'll keep checking on him.
Okay.
Wow.
So, Alfredo, how many times did I come alongside Michael? You're on mute.
Sorry to do my best. I see only once, number 15.
And what happened in that one?
When you say I'm sorry,
When I apologize.
yes.
I think you're right. I think you're absolutely right.
Was it only once?
What questions or
Yes.
reflections do you want to have? And then I will tell you the end of the story.
Sorry, Donna. I'm sorry, excuse me.
Yes,
I
we
said,
can hear you.
what reflections or questions do you want to ask? Alfredo said there was only one time that I came
Yeah.
alongside Michael. It's when I said, I'm sorry.
That I wanted to ask, was it only once?
It was only once.
I was
Yes.
trying to, oh, really?
You
Okay.
had another one? Which one did you have? You had the whole encounter? So
I
glad you
had
did.
4.
Oh, what
Oh my
other ones
God.
did you have? What numbers?
I think the intro, when he, announced himself, the chaplain, and entered.
Bounced in the room, all
Yeah.
happy, knowing
Mhm.
Michael was about to discharge, not coming alongside.
Okay, that's all
What was
right.
the next one? I'm really curious.
Number 3.
Okay. When the chaplain said, way to go, Michael.
Then they went and sat down in space.
Say, hey, want to go over here and sit? In the
Mhm.
parentheses, Michael's like, and barely follows. I'll give you that, Victor. Thank you. Twice I came alongside Michael. Okay. Ask any reflection questions, and then I'm going to share the end of it with you. It takes about 2 minutes.
I felt Michael's frustration.
You felt his frustration.
I felt his frustration because the chaplain continued to be enthusiastic, happy, joyful, and it's apparent that Michael was not happy about being discharged. So I just feel like there should have been an acknowledgement of what he was feeling, and then some empathy with also with his response.
Because acknowledging and empathy would be coming alongside Michael. Excellent. And could begin the assessment journey. Skip.
And it seems like you did what most anyone would do. You came in with the emotional assumption, it's a great day, you're going free. So you were feeling that, and then you took your while to, you seemed to fall short of looking at the facts. What am I gathering here? What am I missing? And then you could readjust your emotion. Oh, this is not a happy day. But who wouldn't go in? Hey, you're free. I mean, who wouldn't be happy at that?
Hopefully now no one would ever go in that way.
Yeah.
Because that's not coming alongside. That's chaplain cheerleader. That's coming in cheering.
Yeah. Supportive.
Yeah. Not even supportive.
I think that the introduction has to be, hi, Michael. How do you feel? Hi, Michael. How do you feel about to be in discharge?
Mm-hmm. That would be a great way to come alongside Michael.
Exactly.
And I learned to say less. Michael, you're being discharged. Shut up. And let Michael take it from there.
Yeah, one observation is just there wasn't a lot of curiosity on the front end. And it seemed like ultimately you might have created more work for yourself on the back end because you said anytime, any need, if that curiosity.
Unpack that, Kate. What happened to the boundaries?
Yeah, so because you were late to the game, say, as we all are, you had to stretch your boundaries more to accommodate your heart for Michael, which was a good heart and a good intention.
Was I stretching for Michael or was I stretching for me?
Scope creep for you.
Yeah. I love a second chance. I wasn't on call that night. I said to the charge nurse, anytime, at about 10 o'clock, I got the call. They called the on-call chaplain who called me. I rushed to the hospital. You can imagine I am so grateful for a second chance. I'm just going to go in here and apologize. So I get on the unit. There's more lights on than usual for 10 o'clock at night, but I'm bouncing my way. I'm going to Michael and I'm going to sit in front of him and I'm going to shut up. Charge nurse comes up to me and says, hey, chaplain, I discovered Michael in his room dead tonight. What? And she says, yeah. And she's teary. And I just sort of sink. And I asked, can I go see Michael? Can I go in the room? It's a coroner's case. There's a police officer at the door. I can't touch, but I can take a couple of steps into the room. Michael's laying on the bed in the same clothes he had on when I talked to him. Even has his shoes on, just laying on the bed and has one hand on his forehead. Still in a fist, as it was when he had left the encounter with me. I come back out and I turn on autopilot. I know we need to do a stress debriefing exercise. So I get the handouts. I put the chairs in the circle. I call my manager who comes to facilitate. I get the snacks. I pass them all out. And my manager says to me, you know what, Donna, sit in the circle. I sit in the circle and everybody's talking. And that's what you do in that stress debriefing moment. It's a crisis intervention. It's trauma-informed care. They're going to just let them talk it out with some certain boundaries. And the staff is going back and forth. And the charge nurse is to my left and is just bawling and begins to say, she told me he was angry and I kept delaying going to his room because I wanted to go when I had time. And then when I did go pop in, I just looked from the door and I thought he was asleep and I didn't want to disturb him. And she's just bawling, right? And I'm just sitting there, and maybe about 30 minutes into the conversation, I realized I'm the last person that Michael interacted with. And they realize it. And they all begin to say, oh my goodness, that's so good. Finally, we have some hope. It's good to know the last person Michael talked to was the chaplain. It's a night shift. They didn't hear what the last conversation was like. I don't open my mouth. I don't say anything. Debriefing is over. I put the chairs up, collect all the stuff, and my manager says to me, do a verbatim, and good night. The next day, the first thing my manager says to me is, why were you at the hospital? So it began with, I wanted a second chance. And sometimes you don't get a second chance. And I didn't. I did not come alongside Michael at all. And at that point, I stood at his bedside going, I never will. A moment has passed. I interpreted his clenched fist even. I hold that image to this day because he clenched it, leaving my presence. No second chance to simply sit beside him. Just come alongside and allow the sharing of information to unfold. It was not by suicide. It was a coronary event, which was determined 3 days later by autopsy, which is about the same time I returned to work. Any other thoughts or feedback or questions? Come alongside, please. Withhold your enthusiasm, emotions, and interpretations, and just come alongside. That is the beginning of the assessment. And as the conversation unfolds, everything else will come to you. You don't have to be ready with questions. You just have to be willing to come alongside. You'll fill in all that other stuff later. You fill in and create your own spiritual assessment tool. You'll discover, oh, I like looking for joy or this or that. I like first finding out about family. I like mapping assets. You'll figure it out. But first, by all means, come alongside them. Sit beside them. Victor.
Yeah. Can you, is it possible to share again? I want to see where he said you're not listening. You know, I wanted to get.
Yeah, I think that's towards the end. Let me pull it up, Victor. No, that's the wrong one. Give me a second, I'll get the right one. He yells, actually, that I'm not listening because he was so clear I wasn't listening. Does anybody have any idea of what do you think might have been happening with me that I so missed coming alongside Michael? I mean, anybody think, hey, this is probably why? I'm still trying to find it. Hold on.
Yeah, the chaplain was euphoric. There was an euphoria that they brought into the space, you know, about, you know, the joy perhaps of discharge.
Mm-hmm.
And apparently it made the chaplain not concentrate. You're not listening. He shouted it. So I wanted to know really how, you know, it played out.
Yeah, he shouted. You're absolutely right.
Yeah.
Shouted, you're not listening.
Do you think that because you met with him every day, that there maybe was some assumptions that you know him? I don't know. I'm trying to remember the clues you said. You met with him every day. That's a lot.
Mm-hmm.
And maybe you just made some assumptions about what he would be feeling or thinking.
Very good, Skip.
Yeah.
I met with him every day over the course of that time. And if you begin to raise questions about bias, and I'm very much aware he's on a locked unit, he's African-American male, he's the only one there. He's a male in a mental health unit.
Mm-hmm.
Yeah, that's coming up for me, isn't it?
Mm-hmm.
I'm probably not coming in the room at that moment with anything other than as was described, euphoria, for maybe my brother,
Mhm. Mm.
Yeah.
and a boundary has been crossed.
Also,
What you were looking for, Victor?
Yeah, somebody wanted to say something. Go on.
Please.
Before I
go
come.
ahead.
yeah. Now, what I was thinking also is the fact that he's getting released, seated in your head. You literally constructed a story that it is a positive news for a African American man in this challenging situation.
Very good. Say that again. I constructed a story, a big story.
Really, yeah.
Thank you, Ram.
Yeah.
Michael was diagnosed with schizoaffective disorder of the depression type. I've been diagnosed with schizoaffective disorder of the depression type. I constructed a whole story, and it all collapsed in that final moment. And I went and I thought about other visits. I had not enmeshed in a moment. It happened over time. And I tell you, I did not notice that we had a similar diagnosis until I did the verbatim. Well, the same diagnosis until I did the verbatim. And my manager said, "Do you realize that?" And I sat back. So it wasn't just my brother getting out, it was me. With nobody. There was nobody to call when he died. He had no family, no contacts. It was my worst fear that I would have a psychotic break, be thrown in an institution, die, and nobody would know.
I noticed the word that he say, nobody listened to me. That means he has a hard time with the nurses also. Not only you as a chaplain.
Yeah.
You know, everybody to try to put their thoughts in him, be
Right.
happy.
And
With
in the
that-
debriefing that went on, the
Yeah.
social worker talked about how he told her he didn't want to leave and she really didn't listen and just telling me I had to leave. The nurse was like, let me explain to you how to take your medication. You are going, went through a discharge plan, and he said, I don't want to go. And so nobody.
Listen.
Kate. Thank you, Alfredo.
So if you were to look back on it now, I mean, you obviously have grown amazingly as a chaplain and would handle that differently. But if you were in the space of maybe one of us coming into that situation and trying to figure out, am I the right person? What should I do? Who should I call? Could you just speak a little bit about what you might have done to turn, besides the verbatim piece, but just an action or two that you might have considered differently?
To change in the moment, right?
Yes, or even just what, say, a first, like a 1A or a 1B might be capable of drawing from at this stage.
So I share this to say, come alongside. Don't come in with your emotions, your energy, your perspective, your assumption, whether it's a cancer diagnosis and you think that must be sad, or someone has just died or whatever. Set all of that aside and come sit next to them. So that 101, I didn't do that. And I think the next place for me was when I realized I was so invested in his discharge and so focused on it. It was when I apologized. In retrospect, I thought maybe I should have hung around a little longer to see if he would talk to me. When I shared that, because I got the question, what would you do differently? I said, that's what I would do. I would have hung around a little longer. Maybe he would have talked to me. I learned from the debriefing, he never came back out the room. And I don't think I would have knocked on his door, because he had set a boundary. He walked away and went to his room and pushed the door up. So come alongside them, set all your stuff aside. Even though you're going to know history, you're going to know some information. You may have had a similar experience. Don't assume that your experience is theirs, your interpretation is theirs. I'm glad I apologized. That was the only redeeming thing in the moment for me. I did manage to say, I'm sorry. And what's not, I don't capture well in the verbatim, was I recall Michael nodding his head like, yeah, but he's mostly walking away like this, right? So yeah, come alongside, meet them.
Yeah, I think I'm just hearing what Reverend Joseph shared with us yesterday, to just wait until you see the whole picture. Yeah, that's what is really coming back to me now.
Good point. Good
Can
point.
I add something to Donna here?
Please.
Thank you so much for this wonderful story and your presentation. When we have a moment that to assess our patient, and this is what I said, do not explain, but explore. So we have tendency to explain what's happening, explain what I did, explain what they will do. Don't go that direction, but explore their feelings, explore their situation. So give them chance to autonomy. They own the story. That's kind of what I want to add here.
Yeah, I think
Not
that's
explain, explore.
excellent. That's a great note to end on. If is there any other comment or question? What's a trauma-informed care awareness you're having right now regarding me? Be my chaplain and use trauma-informed care. I don't blame you. I'd be scared too. Try.
Well, I would think hearing that story and sitting with you in that moment, it brings sadness and responsibility. What's that like for you to be vulnerable to share that with us again?
Very good. So you interpret it before you explore. I would encourage you to just explore. What's it like for you? Share that and revisit that. Great. Another trauma-informed care response. Excellent.
It's pretty acute.
It feels acute.
Yeah.
You're
Amongst
interpreting.
the
Explore.
about type of yeah.
Explore. Ask me. Is it raw? Don't interpret.
Yes.
Explore.
Yeah.
And then the other trauma-informed care piece you want to have on there, and then we need to take a break, is you went back and visited something that was difficult. Are you grounded now? Here. You want to do a breathing exercise.
That's what I meant to say.
That's perfect. So, and even the acute is perfect. It's just don't assume, explore. Come alongside me. Just explore. Okay. And so that would, for the trauma-informed care, when something like that, that would be the question. You'd pay attention. Is their breathing off? Are they speaking quickly? Have they expressed how they're feeling? And if so, invite them, as Alfredo does so well, into taking a few deep breaths. All right. The spiritual care visit that taught me how to shut up. Let's take a break. Would you make it 5 minutes? No, wait. I think you go to lunch and you have an hour. Don't you go to lunch?
Yes.
Yeah, lunchtime.
Yes.
Hey, I'm gonna take care of myself with a bagel. Okay, it's a okay.
Breathe.
So,
Breathe.
Dana, I'll tell you what.
I'm gonna email this call.
I had such a high admiration for your chaplaincy skill. It even went up higher with this one. It was so beautiful.
Thank you. Thank you. I appreciate that. Enjoy your lunch.
Skip, you got the book?
I got the book today. Amazon.
One second, I can hear you.
I got the book
Something's
today.
wrong with
Amazon.
my speaker.
Good for you.
Paperback, like $7 or $8.
Awesome.
Yeah, that's great book. Hold on one second.
What book is that?
The Gift of Imperfection.
My computer. Here we go. Thank you, Skip, to get the book.
Glad to have it.
Yeah, sometimes people can really just couple days.
All right.
Well, I'm quick to buy it, slow to read it, but I'll make the exception.
Yeah.
Part of
So
the
are
reason
we.
I kind of banned Amazon from my life is I went with the World of Books, WOB.com. They only sell used books.
That's
And,
great. Can you share that information? I'll love
Yeah,
to.
WOB.com. That's my go-to site. And
Oh.
I used to be a soft Kindle reader and largely read ebooks. As an eco-sensitive guy, I just want to be careful about minimizing.
Yeah, W-O-B?
WOB.com.
Okay.
Yeah.
World of Books. No, that's
World
new
of Books.
information. Thank you. All right.
Thank you.
I hope you guys
You'll-
enjoyed your
you'll see
lunchtime.
a lot of-
Our next hour is a special presentation, okay, from a professional Buddhist chaplain.
I love it.
And this professional Buddhist chaplain is going to guide you into an in-depth pastoral care for Buddhist care recipients. All right. I'll be behind the scene, but I'll be here. Okay. Okay, Ram, it's all yours for the next 50 minutes.
Thank you. Appreciate that, folks. Yeah. Thank you. Can you all hear me okay?
Yeah.
Okay. Yeah. It's a delight, and I put together a few slides just to it's my way of sharing what I've learned being a Buddhist chaplain in different settings. Prior to my role in the jail chaplain, I have done a reasonable amount of work in hospitals here in Bay Area. I was a couple of weeks in hospice centers and a few other areas. So I try to bring my thoughts together and see I can present in terms of what does it take to care for Buddhist practitioners when we run into them. So happy to learn from your experience as well. I'm sure many of you have run into them and cared for some of practicing Buddhist, and I'd love to hear your stories and your experience as well. So briefly, my experience is I'm a practicing Buddhist. I converted from Hinduism to Buddhism a little over 15 years ago. And I studied and practiced. And when we use the word Buddhism practice, at least in the lineage I am in, we place a lot of emphasis on meditations, long-term silent meditations. So just to give you an example, over the last 12 years, I think since 2012 or 2013, I have done 72 weeks of silent meditation practices, right? Minimum of 1 week at a time. The longest I've been is 4 weeks of silent meditation practice. And this calendar year, I've completed 4 weeks of meditation practice that is very, very core to how I practice Buddhism. So we'll talk more about what the practice means, and some of them may not be meditators. I'll explain that difference as well. I'm also an eco-chaplain for the last 5+ years, where I'm the faculty of the Sati Center for Buddhist Studies. And eco-chaplaincy is bringing nature into the element and support people in a much more nature-oriented environment. In the last 6-7 months, I've been supporting organizations like U.S. Fish and Wildlife, National Park Services, Environmental Protection Agency, and many nonprofits. And just a few days ago this week, I held a grief circle for National Park Services, all the laid-off employees. And they reached out to me, and we held a beautiful 90-minute grief circle for them. And this is the 4th grief circle I've done for just NPS alone. So I'm also a guiding teacher for a Buddhist congregation here in San Jose. And what excites me more is there is a Buddhist nonprofit my teacher founded. I'm running it as the president right now, called Insight World Aid. Part of the reason I took a break from spring earlier this year from my CPE studies was to bring this organization up and running. So the last 6-7 months right now, we've been working a lot in the homeless shelters and homeless field, serving lunches and also dignifying them, having listening circles, and essentially chaplaining that marginalized communities as well. So I work my weekends and evenings quite a bit in that area. Lastly, I'm a Red Cross disaster care spiritual chaplain. I take about 8 to 10 calls a month, and I supported the victims in Texas floods as well recently. And of course, you all know I'm in the 3rd unit of CPE right now, right? So just to get into caring for the Buddhist itself, Buddhism, like most religions or faiths, is not one monolithic thing. There are different things that have evolved over time. Okay? Buddha lived around 563 BCE, and clearly the different sects and the different types have evolved over time. And early Buddhism, which is where Theravada, Theravada, or early Buddhism, is centered a few hundred years after Buddha started, and just as the canon was getting compiled. Okay, the canon is essentially the entire documentation of what Buddha taught, and that's my particular area of my practice is in the early Buddhism. Okay? And years later, Mahayana sect came in, and there are subgroups within that. I'll touch on it in a minute. And it continues to evolve in terms of different faiths in the different way. So when we see an inmate or a patient or someone who says they're a Buddhist, it's really important to ask what lineage they're coming from and what their key aspect is. Some say they are Zen Buddhist, and I'll get into that in a second. And some say they are Tibetan Buddhist. Some say they are, you name it, Chan Buddhist from China, particularly, right? So there are different lineages and different types. And within that, there are sub-lineages like Nyingma tradition. Like, for example, Dalai Lama, who is treated as the head of Buddhism, is really head of the Tibetan Buddhism based in Tibet. Right now, he's on exile in India. So he is part of the Tibetan Buddhism, which is part of Mahayana tradition. That's where he comes from. Okay? So in a nutshell, what I want to lead with is Buddhism emphasizes really more about reality and practice, right? We don't use the term faith or belief. And this is where, if you use the word dictionary, you will hear the word theology. And theology, if you Google the word or at least look in the dictionary, it says study of God or beliefs. It doesn't apply to Buddhism. We use the word dharma, or sometimes we affectionately call it dharmology, is the way things are, how to live in harmony with the truth. Okay? Right from Buddhist teachings, right from going back to 2,600 years ago to modern times, if our experience as you follow the path is different than what Buddha taught, you look at experience at a higher value than whatever the scriptures say. So for all of us, the scriptures are not really an authority. Okay? So in a way, we don't have commandments or any of those, and there is nothing about sacred about any of that. And we put overarching emphasis on our lived-in experience, living with harmony with truth. Right? So I try to put together the definition of, in a nutshell, in 2 sentences, 2-3 sentences. It's really is centered around human experience. Buddha started with what is called the 4 noble truths, and the first noble truth is suffering is part of life, or suffering exists. Right? And the second noble truth, he said, is cause of suffering is clinging or wanting results other than what the reality is. Third is to let go of suffering is to let go of clinging. And then he explored his path. The way to let go of suffering, the path, is called the Eightfold Path. And that's where you cultivate kindness and compassion. And the emphasis here is all beings, not just the human realm. Right? So it translates to really the path is about cultivating wisdom and compassion and training the mind and heart so that we can live with greater freedom and kindness. It's less about believing anything and more about experiencing truth for ourselves. Okay, that's the orientation anyone who's been serious about Buddhism or at least practicing Buddhism strongly believe in, to cultivate the inner state. You know, when I go on a 1-week retreat, first day I'm just settling down from my active life and all the emotions and the activities still working in my head. By second day, I'm settling down. I'm really confronting myself, my own truth, who I am. I'm no longer holding my feelings and thoughts. I'm exposing them in my mind. And I often break down and cry. Doesn't matter how many times I do it. Sometimes just facing myself is Victor, thank you, Victor. So essentially that part really deepens my opening. By third day, fourth day, fifth day, the mind becomes literally thoughtless and calm, and you really get into that emptiness and complete vacuum. You're absolutely experiencing total bliss. I simply can't put it in words. There's no language for me to describe that. So that's why this is really the path of that. Now, from actual practical standpoint, caring for your patients or inmates, there's no one group. For the sake of this discussion, I broke it down into 5 different groups who would say something to do with Buddhism in various capacities. The A is the people who have the religious heritage, tradition, they come from that. That's their whole. We have a guy in jail in W2. He's now in E. And this guy, originally from Cambodia, he's a Buddhist priest in San Jose. I don't know why he got arrested. He's been here for 2.5 years. He's the happiest guy in all of Elmwood jail. Yeah. And people in the jail, in his pod, tell me, this guy, Dung, he said, he doesn't care what's going on. He's just sitting and meditating. He's happily engaging with us. He's very helpful. He cleans the floor, whether it's duty or not. And he seems to be fully content. And initially, he didn't know any English 2.5 years ago when I first met him. Now, being in the jail, he's still working the case. I got to know him quite well, and I meet him regularly. He's such a delight to be part of in terms of how his demeanor is, how he's working the case. He believes in his innocent. He's taking his own time. But we don't see many of A's, but certainly keep in mind, there may be some like that. And you may want to look at what their lineage and what their practice is, where they come from, early Theravada, early tradition. And sometimes they refer to themselves as Vipassana or inside tradition, or Mahayana sects, Zen Buddhism, Tibetan Buddhism. James, I think you're here. You can correct my pronunciation if I'm wrong. Swan Buddhism in Korea, right? Sion or Swan. And then we see Chan Buddhism in China.
We say Son.
Swan. Okay,
Son.
thank
Yeah,
you.
Son.
Right. And these are all Mahayana. And the phrase is in Sanskrit, which was one of the languages around Buddhist time, is dhyan, D-H-Y-A-N, was meant to be inner exploration, and West called it meditation. And that word dhyan, when it went to Tibet, to China, it became Chan, and it just morphed into terms, and it became Zen in Japan. But through Bering Strait in Alaska, whatever it came to the West, it became mindfulness. Right? That's how it's being practiced. The B, category B, is people like me. There's a huge group of us. The centers are all over the country, all over the world. And I can be, in fact, I've tried that. There is always a Buddhist group on Zoom at any time of the day, 24/7. I can join them and sit and practice with them. So that certainly is another way to always keep in with the groups that we are part of. The third group is also huge in the US, which means they are straddling multiple faiths. Okay, you will find many, many, many. In my own congregation, many people are Catholic Buddhists, Protestant Buddhists, Lutheran Buddhists, or Jewish Buddhists, and they call themselves affectionately Jebus, right? So it's really, people literally have faith in two faiths, and they literally practice both of them, one from a pure religious standpoint, and partly because of the family and the other lineages where they come from, and they are exploring the mind and meditation practice and understanding the Buddhist way of doing things, and they're straddling both the faiths. And that segment is also huge. Yeah. I call D as much more exploring Buddhist type. Okay, they haven't really gone into spiritual or religious side yet, but they want to know on the Buddhist teaching. And a lot of the people in D, in my experience, are 20-something or early 30-something people. Yeah. And you see quite a few of them who ask, I'll share with you what kind of literature and what kind of assessment approaches would resonate with each one of these categories, right? And the last one, which is also huge, which is the secular type, I call it generally, but they're largely driven by science of mind and ethical system, and not really believing anything supernatural. Show it to me or explain it to me. That's one way of putting it. The other one, which is in our society right now, in 20-something, 30-something, many of them have never had an outlet to expose their feelings and emotions. They're being trained and taught it's not necessarily, and they really try to intellectualize everything. Many of them have flocked into mindfulness, and if you look at mindfulness books, the meditation apps, there are like a gazillion of them. People practice this left and right, and this is all wonderful, but the origins for it is not a whole lot different than core Buddhist teachings, and you'll see a big chunk of people are just, I'm a mindfulness practitioner. That's all they say. Let me pause here first and see if you guys have any questions on introduction or the types of people, or anything resonates with you about the patients or people you have seen.
Ram, can you just speak for a second about C and what that looks like in real life?
Me?
Yes.
Yeah.
Hyphenated to practice.
Yeah. Oh, C. That C is the hyphenated one. You mean C or B?
C, as in Charlie.
Yeah, C in Charlie. Okay. So these are these are regular people who practice a religion. The most important thing is, and thank you for asking the question. Actually, I missed a key point. The C people still have a lot of belief in God. Okay, they believe in the core scripture, whether it's Torah or it's Bible or Quran. They use that as a way of following the faith. They attend the meeting. I have a big monitor. My slide is here. You're all here. So if I'm looking sideways, I'm looking at you. So they basically are essentially, there is nothing to reconcile because they complement each other. They are not in conflict with one another. Okay. And what does that mean? So you can absolutely following your own faith 100% with all the beliefs, what the scriptures say, which means there is an authority those people place on the scriptures. Okay. And you revere that, and you find that scripture to be sacred. Okay. And that is an extremely important view. On the other hand, they want to really quiet and soften the mind and cultivate the heart and really understand the notion of compassion and kindness are not concepts, but they can be cultivated as a part of the core personality of a human. And I feel they do have, if they intellectualize it, my experience is they ran into conflict. If they don't intellectualize it and let it be as they are, they would have a much simpler and better experience with that whole thing. And that is becoming a bigger and bigger chunk in a lot of ways, what I've seen. Skip, did I answer your question, Kate? Sorry. Thank you. Yeah. Skip, hi.
Thank. It's so educational, so helpful. I have heard the phrase expressed by some practitioners and expressed by some people who are more traditional in a Christian orthodoxy that Jesus was a Buddha. I wonder how insensitive, if insensitive or inappropriate, the phrase like that is. How does that land? What does that mean? I've heard that often.
It's not, I don't believe it's insensitive. The way I would explain is, this is my interpretation. There is no authority on this one. Being a Buddha means you're mentally calm and collected person, and you are very, very deeply compassionate. And there is a word we use in Buddhism called bodhisattva, which means you put others' well-being much higher priority than your own well-being. The Buddha nature or being a Buddha basically means that personality. I'm absolutely sure Jesus is all of that and more. Yeah. And you can apply these nouns and labels anywhere you want. My challenge in general in all of this is anytime we put a label on something, it limits its potential. Language always does that. Okay? And the whole idea of personal sacrifices that Jesus made. And there is nothing that Jesus taught, but what little I know, very, very little, is about self-fulfillment, right? It's about essentially bringing his view of love at such large a scale, at that unconditional level, and that high level of generosity, you can view that as a Buddha nature. And that is really what we it's not about believing in that, but really developing in the path to be that. That's a distinction, if there is one. And Buddha himself said multiple times in the scriptures, in the Buddha's teaching, please don't believe what I am saying. It doesn't matter what I'm saying. Your experience trumps. All I'm saying is this worked for me. This is how I let go of everything and found peace. And Buddha says over and over and over again, so don't hold me in a higher esteem. My teaching is what worked, and if you follow the teaching, you will have results. If not, ask yourself. In fact, in Zen Buddhism, basically there is a phrase they use it called, if you see Buddha on the road, kill him. They say that in a fondest way. The idea is behind, don't hold anyone or anything as a higher value over your own personal love, care, compassion. That is all more important. And the other realm in the eco-chaplaincy, we teach that, which I also believe, is the notion of realms are all about all beings, not just humans. And the today science will prove you, science, I have a lot of data around that, is of all life in this planet, beautiful planet, only 0.02% is humans. All 8 billion of us add up to 0.02%. How do you see spiritual through the spiritual lens, other 99.98% of life? Right? And when you look at it, do you see that as a positive realm? And Kate knows this story. One of my colleagues at work basically texted, "Oh my God, I ran into a cockroach. Me don't like cockroaches." He made something like that and texted in the group. And I kindly responded, "Look, it's a beautiful life form. It has a purpose. Look, this is a value that cockroach brings in our ecosystem. And this is how they are beautiful decomposers. They have a value to play. Without them, the ecosystem would be gone. And that knowing and appreciation is different than liking something and not liking something and let our judgment driving our life. It's an extreme example, but a lot of people got a lot of laughs out of that text. Right? So in a sense, there is a notion of cultivation of heart and really looking at all of life with the same sense. And that's why I'll go into some of the prayers that we normally do, or when you see with these patients, the type of prayers you can use, there's a notion of all beings comes up quite often. In the exploration phase and the practical phase, these this is my judgment of them. Please allow me to do that for this definition. They are very cerebral in many ways. In jail, I've seen so many people who are afraid to share what's in their heart because they never had an outlet to truly experience their feelings and emotions. And we are slowly finding and earning the trust and unlocking them. But even I see some guys with I met with a woman with a graduate school degree in jail a couple of days ago, and she's ultra cerebral, and her view of everything is the line at the bottom. Buddhism is like science of mind. It's ethical system, but I want to understand the science of mind more. How can you help? So if you take a Google window and just type in Buddhist meditation and scientific research, you will see volumes and volumes of research in every major hospital with people wearing the electrodes in the head and really practicing mindfulness and see what it does. And it somehow got into that realm. I have no idea why it transitioned into that phase. Right? So this is the types, right? So what are their needs from a chaplain, right? What would they really expect when a chaplain sees them? For A and B, many people don't know what to expect, or their expectations are limited, but they would want access to some of the things that they're following. Can you get me a scripture on this, the book on this, the book on that? Or some people, depending on the Mahayana tradition, they are very particular of having a Buddhist bracelet. This is not how Buddha taught, but the later traditions place a lot of importance on it. Okay. And in the conversation-wise, they want to really be engaging on a spiritual conversation, more about workings of the mind. Right. And they want someone to be willing to listen to their experience of that exploration. And none of these people really expect a prayer. I'll talk about prayer in a couple of slides, but certainly they would want to have more of a heartfelt and more emotions-oriented or feelings-oriented conversation, and that conversation is what they term as spiritual conversation. Whereas if you see a hyphenated Buddhist, prayer is an appropriate thing. It's highly valued, including intercessory prayer. Intercessory prayer doesn't show up in Buddhism at all, but certainly in this context for category C, they essentially want the similar things as the A and B want, but they also are very interested in the prayer. Okay. So the D's and E's, and D's particularly, they are into, I'll give you examples of the books and tools that would help them, a couple of slides down, but really they're more interested in digging more. Here's the time I have. How can I learn more about this? What does Four Noble Truths mean? What does Eightfold Path mean? There are many, many books. I'll give you a recommendation of the authors in the books as well. Of course, the mindfulness practitioners would love to have a recording of some of the mindfulness meditations. And most of them in the hospital setting, what I've seen is they have the cell phone or something, they put their headphones on, and they follow whatever extent they can. In a jail setting, every inmate gets a tablet. In the tablet are a whole bunch of recordings of so many other meditation practices. So I guide them through which one to listen and how to go about listening to them if they want it. Yeah. And anything relate, any interesting article about mindfulness and they relate to that is of high value to them. And outside in, if I look at it, there's a huge growing market in D&E, right? For example, when we go on retreats, typical retreat center has about 50 people as a capacity. And we get about 400 to 500 applications every week. And then these are nonstop, 52 weeks there are retreats happening. And that demand for that continues to rise. So people wanting deeper and deeper retreat practice, and that popularity is on the rise as well. And the next two slides really give you some inner depth into caring. So when we learned beautiful this morning from Donna about the assessment approaches, and it touched me so much in the way Donna presented, and I took quite a bit of notes as well. So here, when we meet either A, B, C, D, or E, the curiosity aspect, I call it, is to ask more along the lines of understanding their purpose and then meaning. It's not about who do you believe in or what do you believe in, or even asking about the faith. It's about what gives you a sense of purpose and direction in life. And we ask the same question within our own congregation. And I teach Wednesday nights, and last night I was teaching them, and our whole focus was cultivating heart when we see a homeless man at a traffic light. What arises for us at the time? Do we drive past them? Do we take them? And many of us have asked them to hop into the car and taken to the restaurant and fed them, had a meal with them, connected with them, and had a conversation with them. Whatever it is, we are asking them, how does that act happen from within, and what are the driving factors, or what practices allowed them to grow into that, right? So that's the kind of a purpose and direction conversation many of these people would be very interested in. Yeah. In terms of framing around meaning making, is really, I loosely use the word grounding beliefs, but really more about what are the basis of their thought process, what principles do they hold dear. And these are the words directly from the Buddhist practitioners. Also, although there's a lot of rejection in Buddhist community, calling anything as a philosophy is not allowed in general. But people say, this is my philosophy in life. They're okay with using that phrase and communicating as such. And their whole notion is, this is how I see life and the world. And what immediately follows is, I know my view is impermanent. This is fast changing. I'm not going to hold on to this view. Which is one of the core teachings of Buddha, is to look at entire life through three characteristics. One of them is see impermanence. Anything you see is not going to be the same way. And the second characteristic is, no matter who you are, you're going to change. There is no permanent sense of self. It's a constructed phenomena. At this presentation, I'm a 2A CPE student with a background in Buddhism. I'm engaging with this, and this role ends when this presentation ends in another 25 minutes. Right? Then I become an entirely listener and different entity I take. And I'm cognizant of it, because this is a very important teaching about understanding our own egos and how much they can control our life. And that is emphasized in the grounding beliefs. And the source of meaning and fulfillment, where do you find purpose of joy? You can even qualify it in your life or work. And what communities or groups that you belong in. There are three refuges Buddhists are known for. That's part of the thing we chant. We take refuge in Buddha's teachings. We take refuge in the Dharma. And we take refuge in the Sangha. Sangha is a word for community. Right? And that's something sacred for most Buddhists. And you can ask them, what is your notion of community, and what do you call that spiritual group as your home? And even we can go to the point of resources and challenges. When life gets difficult, what ideas, practices, relationships help you cope? Last summer, we had last April, May, we got the news. My daughter, who lives in Denver, she called, Dad, Mom, don't tell anyone. I think I'm pregnant. And my wife felt thrilled, happy. We're all happy. And a month later, she says she had a molar pregnancy and a miscarriage. And I see it devastated my wife. And it got worse. 3 weeks later, we have some serious issues. I'm going to be on chemotherapy for next year or so. She was in chemo for over 10 months. My wife and I took turns to go to Denver and back. And I can see, I joined her to the oncology visit and went to the hospital. And I'm supporting her as a parent, but I'm fully aware this is part of life's experience of unknown. Right? There's an acceptance or allowing for that experience to be as is, so that it doesn't consume my mind and heart and makes me less effective. Right? This is a significant difference between my orientation to the same event versus my wife's orientation to the same event. Right? And when you go there, my daughter and I were beautifully chatting. You know what, Dad? And I come to this building, the oncologist building, and she's coming for that chemo. I joined her for the visit. There's so many people in a lot worse shape than I am. It was so beautiful to hear her say that. Instead of her making it as all about herself or center of that. Right? And we all have a different perspective of the suffering, and whole idea of this approach here is we don't let anyone, anything, this is what, it's not ideal what I'm saying, but our goal is let that not take away the true self of who we are. And in a funny way we say is, no one's going to live in my mind without paying the rent. Right? So it's a kind of a funny way we say that, but it's really what it is. Questions on this? I have one more slide on this. Let me pause here. No? Okay, moving on.
Uh,
Yeah, go ahead. Sorry, Jennifer.
Sorry, thank you so much, Ram. This is very enlightening. I'm just curious about the bracelet. What does that signify? Or what is it for? You did mention about the bracelet.
What is great? Bracelet, yeah.
Bracelet, yeah.
Yeah. So some traditions, the patients ask for bracelet because they won't have some somatic experience when they are meditating. For example, if you're meditating from a breath to breath, yeah, the mind wanders off easily if you're not very focused, but that is the nature of the mind. Yeah. So it was not taught in Buddhism, but subsequently they added this is, if you do inhale and exhale, you advance one bead in the bracelet. It's a way to keep a somatic action in present. And so when Buddha taught mindfulness of breathing, he also taught along with it what is called the mindfulness of body, and bring all of your presence through the body, which is very powerful for me to apply in chaplaincy situation. Is not just how grounded I am, how is my body feeling right now? Right? At the deepest level, am I fully relaxed? Is the oxygen fully going in and out? Is it simple enough? Because I know what the meditation practice taught me is anytime I'm not that relaxed, I notice certain tensions and certain tightness in different parts of my body. That tells me I am not at ease. So the practice, and people who practice use the bracelet as a guide or an anchor in addition to the breath, to keep their coming back to the breath meditation while having the somatic touch in their hand. So continuing on the assessments, right? We can go, such as going into a little deeper, and you can ask them, would you like to share what being Buddhist means to you? Yeah. And there is a foundation questions or a practice and discipline or related questions is, what Buddhist teachings or practices do you feel central to your life? You know, how do you understand the notion of compassion or impermanence or suffering in your own journey? These three words come all the time: suffering, impermanence, and compassion. And if you want to support them, sometimes, is there any specific literature or articles by teachers that you're interested in that I can bring you? Because the thing in jail setting, which is particularly true, is no one comes to visit them who can give them books or papers, right? And we are the only sources to give any material to them. So we play that role of fulfillment in many ways because they don't have a cell phone, they can call anyone. And we are asking some of these questions or bringing that into the assessment so that we can support them the right way. And we can explore them about what is your typical practice, either chanting or mindfulness, meditation, right? And even inquire, what does this practice does to you? Are there anything constraining you from following your practices right now? If so, what they are? So in a spiritual sense, right, the type of conversations they would feel very interested in learning would be notions of self-compassion and compassion for all. That's particularly true with types A and B. Okay. How are you caring for yourself? How do you feel about your own self-compassion? One of the most common refrain in Buddhist teachings from Buddha directly is, life is all about caring for yourself, caring for others, caring for yourself and others, in that order. Yeah, caring for yourself, caring for others, caring for yourself and others. It comes up consistently. So the notion of self-care and self-compassion is not selfish, but essential for them to be grounded so that they can be a resource to others. And the notion, again, is the notion of impermanence. Explore is, how are they finding themselves in the environment that they are in? And what is the support that would be most meaningful to them? And sometimes you can explore to them, even though you don't have to be a meditator. You can just say, hey, can we meditate together? Close your eyes and remain silent for a few minutes. They would deeply appreciate that. So when you go to see, then you have a lot more opportunity to bring your own faith in and explore internal and external aspects of spirituality. What does that mean is there anything that you feel like God or your scripture has directed you to engage and do that you want to participate in? And how does it feel like you not being able to do that right now? And many times you ask the question, what is your version of God? Buddha never said there is no God. Some Buddhists make this up. There is never a conversation around that. And I always tell people when I pray with them, both intercessory prayer or others, I tell them, dear God, and I go through the prayer. Some people ask me, who is your version of God? And I always point to nature is my God. Okay. And I revere every tree, every life being in such a high level. In a sense, I bring that reverential divine feeling in my heart, invoking that aspect of it. And when I'm essentially holding someone and after doing a death notification or whatever, and I'm praying with them, I am with that so that my heart's connected to that prayer as much as the person I'm praying with. So if you go to the D's and E's, particularly D is a lot about asking how are they processing the situation, because they're in the early stages of exploring a faith or Buddhism, I should say, and they have a lot of questions and they don't want the answers, but someone to listen to the questions. And compassionate listening plays a huge role in that. And the E's are sometimes they are on the edge, which generally they're not interested in God. And I've had extreme cases, some people it's a trigger. Don't bring the G word. Right? And there's no reason for that. Buddhists never advocate that. They generally want to explore that. Right? So moving on. So I just put in a slide of my last slide in terms of typical topics and authors to consider and what kind of for the ABCDE, any resources you can support, right? Obviously, any topics around the precepts, Four Noble Truths, Eightfold Path, or cultivating heart qualities would be of high value to them. And there are some famous authors. Each one of them is highly respected. If you are to find a book by any one of these authors, Joseph Goldstein, Thich Nhat Hanh, Bhante Gunaratne, Bhikkhu Nalio, and Gil Franzlau. Gil is my teacher, right? And I also say, when in doubt, offer to meditate in silence. And the typical prayer for all of us is, may all beings be free from suffering. May all beings always find peace in their hearts. It's never about us. And there is a growing set of books that are coming in about blending this for particularly audience in C. This is called Christian Insight Meditation. There's one author who wrote, Amy Ogden, wrote the book, The Practice of Christian Mindfulness. And the other author I know, Mary Jo Meadow, I don't know if I can show this in front of the camera. It is the Christian Insight Meditation. And in Elmwood Jail, in 3 of the pods who are in my meditation class, they have a very, very sincere Bible study class. And they use this book before the class or end of the class to meditate together before they study. Okay. So they're essentially following the footsteps of John of the Cross, it says. And it talks about Buddhist themes and meditations, how it works well with the practitioners of Christianity. It's a great book. Right? So that's what I came prepared with. So in summary, what the CPE is teaching is everything you need to know to support Buddhists. I think what I presented to you is some nuances that will help you to get the perspective of where they would be coming from and how you can potentially prepare for it. When in doubt, send me an email or text. I'll call you back and respond as fast as I can. Thank you. Questions?
Thank you, Ram.
Jim, thank you.
Well, I'm before I ask the question, I do not want it to be received as like me doing harm. I'm just curious. This is just me asking questions. But I guess just thinking about it, would it be safe to say that Buddhism is like psychology before psychology?
Very much so. Very much so.
I'm just trying to think about it.
You hit it right on the head. It's so instinctive. It's so beautiful that you picked that. There is, in 2,600 years old, they compiled Buddhist psychology in a book called in a canon called Abhidharma, which is how it is defined from every mental state and every transition. I'm taking that in-depth course right now. It goes for the next 6 months. My Saturdays, every other Saturday is very long. And there are about 180 people in the class on Zoom. And 2/3 of them are psychiatrists and psychologists. And the whole idea is about, this is why I personally, this is Ram's judgment, I don't perceive this to be a religion per se. it is about me knowing myself really clearly well. Where are my idiosyncrasies coming from?
Yeah.
Right? And how can I be fully present in a situation with kindness and compassion and love every moment? Just like when I'm breathing, when I'm taking breath meditation, I have a choice. Do I follow the thought or let go of the thought, come back to the breath? How do I train my mind to know that I have my ultimate choice? No, that's my free will in action.
Mm.
Because I get caught up in my constructed stories of my thoughts if I am not mindful. And I act on the stories, believing them. Right? And that nuance is what I try to remember as often as I can. And I can't do that intellectually without having a meditation practice to support me. Because it's not about knowing. We all know that, not to get distracted, focus, easily said than done. Right? That how do you make that instinct a natural part of your life?
I also had another question, just curious, just again curious, like just asking what, how do you have you had to in your chaplain assessments for Buddhists, how do you assess karma? Is karma assessed at all?
Yeah, a great question. I didn't touch on it at all, not wanting to complicate this, but it's a perfect time for me to answer that. Not so much with the word karma. What the Buddhism asks you is before you take an action, consider consequences. Okay? It doesn't say good or bad. Okay. Whatever it is, you're going to bear the consequences down the road. Maybe this life, next life. There's a book in my collection, Introduction to Buddhist Ethics. That's 500 pages long, introduction. Okay. And all of the book is about talking about these consequences. Don't get into good, bad, or dualities of the world. Know that there are consequences for those actions. And some people can label it as karma and points and all the stuff. Right. And one of the religious things people debate in the Western world is, are Buddhists vegans or vegetarians? No, there was no teaching ever. Buddha said you shall remain vegetarian. Scriptures say Buddha died of pork poisoning because he is collecting alms every day, one meal a day around 11:30 a.m. That's why when I attend monastic retreat, that's all the meal I get, one meal, right? So whatever comes in the alms is what you eat. I'm not asking for vegan, no butter, no salt, no. I don't have a preference. Whatever falls in my bowl is what I eat, right? So the notion of first do no harm gets extended into vegetarianism, veganism. There is no basis for any of that. But all of this is built around consequence of karma, and know that if you can be kind to a situation, make that a priority.
Thank you.
Victor.
Yeah, thank you, Ram. Mine is rendering spiritual care to a Buddhist care recipient or grief support. That one is a very personal one. I had not in my clinical site, but I was called as a priest. So, and I thought I was meeting a Catholic family that was bereaved. But lo and behold, I walked in, there was a Buddhist family, and a whole lot of them filled the room. And I called you, I stepped out and I called you.
I know you did. Yes.
So I wanted to know what to do to this, with this Buddhist family. So answer it for the benefit of all of us, grief support or rendering even spiritual care to a Buddhist family or care recipient.
Yeah, thank you for the question. Again, my apologies. That was at the beginning of a 2-week retreat. I was back in May. When we are in retreat, we surrender our phones. No electronics, no books, nothing with us. We have 4 walls and a pillow and a bed cover, right? And by the time I picked up the message, was too late. I think the notion of grieving in Buddhism is a great question, or supporting in the death. If they are following the death, many of them have the notion of impermanence and acceptance already there. Okay. And the notion of empathy would probably lean towards compassion to tell them about, may your suffering be alleviated through this practice. So the question, because all of Buddha's teaching centered from his direct experience with three things: old age, disease, and death. Sometimes we say life is odd, or old age, disease, and death. And these are most inevitable aspect of existence, life, any life that exists. Why are you in denial of this and keep confronting this and wasting your energy? That's a core to Buddhist teaching, right? So most of the people in the path are, and we all done that. I've done Maranasati, which is the contemplation of death, many, many times. And I've done that many weeks of it. And I think about what is my residual duty to my daughters? What is my duty to my wife? And I go into that thinking, I have a sense of acceptance when I pass away, whatever it is. I have some of the conversations already taking place. And the only reason I do it at 65, because I'll be 66 next July. And if I go back, my father's side and my mother's side, for 4 generations of men, no one lived past 66. Right? So who knows when the batteries are going to run out, right? So part of this, all of this is that I don't want to just live under the fear or have the unnecessary fight in my mind if it could happen. When that's all meaningless, it's completely, might as well be fully present and engage, bring that into conversation, live with it, share it, laugh it, and participate in that. Thank you. Thank you, guys. Appreciate that. Are we
Thanks so
taking a
much,
break now?
Ram.
Are we taking a break now? Reverend
Yes,
Joseph?
so before we go, Ram, there are some comments on the chat box, so please respond to those
Okay, thank
great
you.
comments about your didactic in the chat box.
Okay.
Thank you again, Ram, for your expertise and commitment and living out Buddhism. And as James said, we can sense it is embodied in you. Thanks so much for living embodiment of Buddhism.
Thank you. Appreciate that.
Right.
Take care.
So now that both Ram and Alice are here, I'm still waiting for the documents signed and sent back to me from Ram and Alice. If you did send me, somehow I didn't get them. Okay. Rest of you, let's take a 5-minute break, and then Donna has prepared another didactic for us. Okay. All right. That is, I think it's about what is chaplain. Alice, can you, for the next hour, can you do the four temperament quiz and send me the result? Just give me the numbers for strength and weaknesses. I sent you an email last night. Okay, all right. I need that before I begin my didactic.
Okay.
So yeah, just send me the result. 4
I
numbers
was
for the
so
strength, 4 numbers for the weaknesses. Good to see you back.
I was so swamped until now that I couldn't do anything after classes. I was
No
preparing for
problem.
my
Yeah,
lecture.
I know you were
Yeah, I'll do
something.
that. I'll do that and send to you.
Okay, thank you.
And then about registering.
It's a 4 temperament test. I sent you
No,
last night.
I need to also register.
Yes, you need to register too, and then Chaplain Donna will help you.
Okay, thank you so much.
After the orientation today. Okay.
Okay, thank you.
All right. I also need your documents, 4 documents that I want you to sign and send me. Okay.
Yeah, I'll do all that before I leave for home today.
Good.
Thank you.
And then the 4 temperament quiz, I need it within an hour.
Okay, no problem.
Okay.
I'll do it on my phone, and then I might can I put in the chat private to you?
Yes, you can do that.
Okay, thank you.
Oh. What did I do? Skip, is that large enough for you to see it clearly?
It is if I get closer, but I have to get a little bit closer. But I can see it now. If you don't mind my big nose in the screen.
Wonder how I can make it larger. Kate, is there a way for me to make this easier to read by making it larger?
No, I've found on my own screen that I can zoom in and it blows up for me. I don't think you all necessarily see it, but maybe Skip, if you try like how you expand on a phone on your mouse pad, or there's also a little, if you only have a mouse, a little percentage sign in the lower right side that can show it for you.
Okay.
Do you see that?
Okay, so is this size okay? Should I leave this and then let everybody adjust? Okay.
It's worked for me so far. I don't
And
know
you're
if
able to
Skip
see,
has the
okay.
same perspective, but
All right.
okay.
Going to full screen helped too,
Oh, okay. Thank you. Let me go to full screen too.
because it made your display bigger and then the galleries on the side. But the screen is bigger if I go to the option at the bottom right, full screen.
Jennifer, are you able to see this? Kate and Skip, can you share what you just said about going to full screen and making it larger?
I went to the bottom right of, I have Adele, and if you go full screen, it'll make the display larger, and you probably can mute the, you see the participants on the side, but you can see it's bigger. So full screen.
Okay. Mhm.
And
Oh,
then,
yes, very helpful. Thank you.
and then Kate, you talked about sliding something to the right and making it even larger.
Yeah, and then if you zoom in, like you zoom in on your phone, or if you don't have a touchpad or a touch screen, use your mouse and go to the lower right side of the Zoom like application. There's a little percentage thing. You can play with expanding the size of it to fit your screen and your eyes.
Thank you for that. That's so helpful. So what we're gonna talk about this afternoon is through this, the identity of sort of this role of chaplain, pastor, social worker, and therapist. And the way we're expounding our understanding of the role of the chaplain is kind of sort of looking at some of these other roles where we often think we overlap. And so as I go through each one, it will be so helpful if, particularly as we go down, we're going to go across primary context for chaplain, pastor, social worker, therapist. If you would talk about what you might identify as the limitations of what I have in the chart, what might be missing, what doesn't it include as we're nuancing our understanding. So I will send you the chart, but I really just want to use it as a talking point. And so let's try the first one before I break you up into a small group, and I'll watch the time for an exercise. And so we won't spend a lot of time with it, but a little time with it. So for example, as if I'm defining the role of the chaplain, I think about the primary context, institutions, the pluralistic spaces like hospital, military, prisons, university, hospice, corporations, and you can name probably some more. So that primary context is a significant part of describing the role of the chaplain. It doesn't mean a chaplain can't be in a faith community or serve in a congregation, but that's not their primary context. Any pushback on that, or a desire to nuance it in some way?
I would only add, I think sometimes geographically, the institution may look different in somewhat from Midwest to the East, to the coast, to so geographically, a hospital here is going to look different from one in maybe some of the areas where you're serving. But I mean, that's going to happen probably in any institution.
Okay, I think that's very helpful observation. Yeah. And then, James, is your hand up? No?
No, just
Okay.
posing myself comfortably.
Gotcha. And then on the screen, it looks like it was up. It's probably something I have, sorry. And so when we think, again, primary context, pastor, congregational, faith community, doesn't mean they're never in those others contexts, but the primary context in which someone functions in the role as a pastor, those pretty much capture it. Social worker, community agencies, hospitals, schools, government programs, and then therapists, often private practice, but clinics, hospitals, community mental health centers. So that's just the primary context. And even within there, in addition to what Skip has pointed out about geography, there's all sorts of diversity and overlap. Well, let's talk about the authority base. So for the chaplain, it's an institutional role, professional certification, and relational authority, as opposed to the pastor, where it's a denominational ordination of some sort or a denominational affirmation of authority in some sort of way, and then often authority in a congregation. And then social worker, professional license, accreditation, agency standards. I would add that for the pastor, their ordination ability to be ordained is often linked to the acquisition of certain degrees or certifications, like some require CPE training, some require seminary, etc. And then a therapist, a host of professional license. So anything you would nuance about the authority base of a chaplain as it's described, or of a pastor in particular, I want you to focus on those two. Any nuance or pushback or question? I would have expected some pushback on relational authority as not being part of the pastor's authority, but okay, for all the pastors in the room, I'll yield to you. All right, scope of care, no confession, scope of care. All faiths and none, spiritual and emotional. And we talked earlier about why that's exchanged, and that whole existential support in crisis, or existential support in a particular situation, as opposed to protracted. Whereas the pastor, members of a specific faith community, focused on spiritual growth and worship. It doesn't mean you don't function in some way as a chaplain to participate in worship, but that's not the primary function. And often when a chaplain participates in worship, they do so leaning towards their pastoral presence. Because when they participate in worship, even when it's interfaith, it's interfaith. And therefore it excludes people who are not of any faith tradition in a way that chaplains would not. So you sort of lean towards your pastoral presence, even when you're doing worship as a chaplain. Any pushback on that? Question? Want to nuance it? This is going to be easy.
So, a quick
Hey.
question, actually. Hi, may I ask a question, Dana?
I saw Kate, and then there was somebody. Oh, Skip. Okay. Yes, please. Sorry.
I was just gonna add that scope of care in jail, and especially for like county funding, federal funding, money that comes from somewhere else, like mental health practitioners, for example, tend to run out of money quickly. And so in our context, they deal a lot with acute things, but ongoing things, very often they'll pass off to chaplains as good listeners. And so some of what you've said here, I look at the whole category and I think, oh my gosh, we do all of those because, for example, it's very common for mental health to diagnose suicide and then refer to us so we can explore that in ongoing conversation. Or then they, maybe someone on the outside dies and the family contacts us and we're going back and forth with the family and the inmate and dialoguing. Our primary support is kind of gatekeeper and advocate and guard for the inmate, but there's a lot of
back and forth
crossing that happens, and with volunteers and with county employees and with inmates themselves and with just, it kind of expands.
Got it. That's very helpful. Skip,
Right.
thank you.
Oh, I did not have a question. I'm sorry.
Okay. Who
No,
was
I
the
had,
other person?
I had a question, Donna. This is
Okay,
Ram.
Ram. Thank you.
I'm building on what Kate started. In fact, right, the therapist column can be a mental health professional too, right? In a sense, in many ways. Okay.
They often
Yeah.
think of
Yeah.
themselves as mental health professionals. Yeah.
So the thing I love this classification. I do think they're like a shades of spectrum as against solid lines between them, right? That's kind of what Kate mentioned as well. The thing that where I feel the additional, I want to use the word burden carefully as a chaplain, is one element of mental health is over medication of the inmates. They load them up with so many meds, right? And I've seen people behavior dramatically change once they go into that phase. And there, that forces us, to some extent, I'm responding to that by becoming a social worker or a pastor or whatever different roles, because the person's personality itself seems to be changing.
So
Okay.
the scope of your care, part of what dictates the scope of your care is the circumstances.
Circumstance, correct. Well said, beautifully said. Yeah.
Very good. Okay, that's extremely helpful.
Yeah.
So let's look at the core activities. So the chaplain, I would argue spiritual assessment is uniquely done by chaplains. That is what sets you apart, your ability to do a spiritual assessment. Presence, rituals, crisis support, advocacy, teamwork. Pastor, preaching, teaching, sacraments, counseling, leadership, case management for the social worker, case management, advocacy, resource, connection, crisis intervention. And then for the therapist, counseling, psychotherapy, diagnosis, treatment, planning. That treatment planning is, sometimes we talk about the ways in which they're trying to fix, they have a diagnosis and they're trying to fix or create a state of wellness that is not defined by cure, but resiliency and living with whatever might be the situation. So what do you think about those core activities? Yes, Audrey.
I have a question. Would the chaplain ever be expected, and it maybe depends on the setting, to do any of the sacraments?
The chaplain would, and not do them. The distinction, Audrey, great question, would be the chaplain could be called upon to do a ritual or a sacrament, and they do the ritual or sacrament with the authority of the requesting party, regardless of whether or not they have the authority of the traditions that do that. So, for example, I might marry in the hospital a same-sex couple because the law allows me to do that, and the couple has made that request, but my tradition, faith tradition, does not give me the authority to marry same-sex couples. Or I might provide communion, but I do not have the authority to officiate communion or baptism in my tradition, but I'm not functioning as a pastor, I'm functioning as a chaplain.
Very good.
So some of the
Okay, great,
challenge,
thank you.
yeah, some of the challenge I get as a manager of chaplains is when the new hire says to me, hey, this patient wants me to baptize them, but in my faith tradition, I don't baptize. And I say, I understand, step out your faith tradition and be a chaplain and go baptize. Because you're coming alongside them. And what your faith tradition allows you to do or does not do is not the column, looking at this chart, that you're operating in. And that could be difficult to grow into that. Skip?
Yeah, I think the descriptions under chaplain core identities to patient care is spot on. I'm wondering if a lot of our role is related to care for the staff, because
You're going to identity or core activities? Where are you?
I'm core activities.
Okay. So core activities where you are as a chaplain is related to staff. Go ahead.
And then teamwork. Does teamwork relate to staff? Because I feel like when we do staff care, it's more than teamwork. Often it's crisis intervention, it's counseling, it's support. For many of them, we're the religious authority in their life, good or bad. So it seems to be more than teamwork. It tends to be staff care.
Okay. So teamwork refers to the ability to work with an interdisciplinary team. Okay. So it's not about the numbers, a group of people. It's the skill, one of your outcomes and indicators, of being able to work with an interdisciplinary team within your discipline as a chaplain. And I appreciate your transparency and say, hey, good or bad, I'm the religious authority for some of the staff. I want to encourage you to push back on that. Because as a chaplain, you are not a religious authority. Because as soon as you become a religious authority, you limit your ability to be a spiritual and emotional authority for all people. Because now you're in a single lane of religion, which limits your ability. So I encourage you to push back on that title and given to you and claim your authority as chaplain.
So with that, where would staff support under core values with the chaplain? Where would that fall?
Under core activities, it falls under support.
Support, okay.
Great. Alice and Jim?
Go ahead, Alice.
This is my question. And like you, I know you value intersectionality. And that's where my question lies. You are a chaplain in a hospital. You are a pastor in your congregation. Okay. You are in the chaplain in the hospital. You have a congregational member who sees you as a pastor. And something happens. And then the staff in the hospital know that this patient's chaplain is also a pastor. And they invoke the pastoral dimension of this chaplain. Within the context of what you just said, how will you respond?
Jim, I don't like Alice's question, so I'm going to you. No, I'm just kidding. So I think, Alice, you raised a great question, and I would love to hear what people think. What would you do?
We talked about context. So context is very key in this. So if it is hospital, hospital or correctional facility, the context. If it is properly in the church or within your pastoral engagements and all that. So the context defines all that, not just location though, but the context basically, qualifies which cap you should wear, since you have to, but the context will now determine. That's my response. I don't know if it's okay.
That's helpful. Thank you. So the context is, anybody else? Audrey, you wanted to also contribute before we go to Jim's question or comment?
Well, I just kind of like how you said it earlier when I asked the question. It's basically meeting the need of the particular patient, person, family member, and being as chaplain, we're able to meet the need under their authority and their request and what they need, as opposed to the pastoral relationship. So I wouldn't look at it as pastoral activities. If I'm there as a chaplain and if they ask me to do something or need me to do something that a pastor would normally do, and I can do it and they want it, then I would just look at it as a chaplain activity. I would be operating as a chaplain, meeting a need.
You would come alongside them.
Yes.
Want to say something though. I'm not saying that's what we would do, we as chaplain. That's how we understand our duty. But then the staff sees you now in that role, because the whole thing is, from the perspective of the staff, as long as you are there as a chaplain, that's who they should see you, a chaplain. And then the staff now hears these two roles that you inhabit. And then the staff begin to see you, confuse this role to know, even though you are there as long as you are in that location, you are a chaplain. They start confusing this role because, Donna, you said something like, you help them understand, I am a chaplain, right? So I'm speaking from the perspective of the staff. We know what we are supposed to do. Regardless of if that person is from your faith tradition, you walk alongside regardless. It's an interfaith, which means every faith, including the ones of your own church. But it is the staff, their perspective now is, now I would say, they don't just say you are only this or this. So how do you help the staff keep that understanding of your function in that location? That's my concern.
I'm not sure that you have to on a regular basis do that, but there have been occasions when I have come into the room with my badge on and I'm a local pastor and I look over and oh my goodness, there's a member of my church. And I have literally turned to the nurse and I've said, I'm going to take my badge off, go downstairs, get a visitor's badge, and be on break. I'm their pastor. And I've done that. I take my badge off, I go get the visitor, and I'm standing there as visiting clergy. I've been in the room when the physician is having a family meeting, and I've distinctly, this particular one, I'm present, and the physician sees me and says, I am so glad you are here, chaplain. And I look and I go, oh, no, I'm not here as a chaplain. I'm here as their local pastor, but I can page the chaplain. And I paged whoever the chaplain was that day, I don't remember, so they could come. And the physician was a little confused. He was like, no, you're good enough. And I was like, no, you're calling a family meeting and you were glad the chaplain was here. Let's get the chaplain here because I'm pastor and it's a different role. So I'm not sure you have to do that a lot, but I know of those two occasions when I just distinctly made the boundary and communicated my role. So, okay, great. Well, Jim has an easy question. Go ahead, Jim.
I think he just answered it. I was struggling with my identity and my authority, and which hat to wear. And you basically just, you said I take off this hat, I put the other hat on, and
Jim, how do you know when to take one off and which one to put on?
well, what I heard you say in that scenario was when they requested specifically the chaplain or the pastor. And I was just kind of before you answered all that and Alice's question, my thought was like on last rites and specifically in like Protestant denomination, like in just thinking about the two sacraments, like like baptism before death and that kind of thing, and like what role to play, like how to put that hat on if that's asked. Like
Right.
I'd like to be baptized before I die, but I'd like, do I call then the Catholic chaplain, or do I, like you said, being a manager of chaplains, you've said step out of your comfort zone and go do it. Is that a scenario where you just go do it?
Oh, no, I didn't say comfort zone. I asked them to
Oh,
step out of the other role and step
other
in.
role. Okay. Got it.
So the way I know what I'm showing up as is how I'm coming alongside them.
Okay.
So if the person in the bed, I walked in the room, in that case, they go, Pastor, I am so glad you're here. Well, I'm real clear. They called me pastor. I'm coming alongside them as pastor.
Okay.
When I was with that family, they called their pastor to come because they were concerned about meeting with the doctor. The doctor didn't call the chaplain to come to the meeting. I wasn't coming alongside the doctor. I was coming alongside. You follow? So who
Yeah.
I'm sitting next to, who I'm coming alongside, determines how I'm showing up. And if there is some conflict with that, then that's when I have to begin to perhaps call a colleague, figure out how do I do this, what's going on. So if they want to be baptized by Jim just before they die, and they say, Chaplain Jim, come here and baptize me, I expect Chaplain Jim to go and baptize. If they say, I want a priest to come baptize me, Chaplain Jim, then I expect Chaplain Jim to exercise his interdisciplinary skills and coordinate with whoever he needs to coordinate with to access a priest. Some people have to go through social workers in their context. Other people can directly contact a priest. But I don't expect Jim to make the call, well, hey, I don't do that, so I'm going to call somebody who does. No. Let's look at your identity on the chart. The chaplain is a guest in another's space. You're going to be the guest in that other space. Priest, meditation facilitator, ritual facilitator, on and on and on. The pastor is going to, that expression, shepherd a flock, a spiritual leader for a particular community, and is engaged in fostering that community into the creeds, beliefs, commitments, morals, values of that context, and will have limitations. So I don't expect the pastor of First Baptist Church to come and function at the hospital in the skills of a Catholic priest. Not unless they're a chaplain. And then I don't want them to function as a Catholic priest. I want them to function as a chaplain.
Mm-hmm. I feel like they're like in my context, like I have to do a lot more like teaching because they don't know the difference. I may know the difference of my identity and role, but they don't. And so it sounds like I need to do more explaining in the moment when that happens.
And that's into your outcomes and indicators when you begin to claim your authority as a chaplain and what that looks like. It's also when you get your orienting system important and matters, but it doesn't trump when you're functioning in the role of a chaplain, the orienting system of the spiritual care receiver. In fact, it falls away and yields to them. That gets difficult. It's not easy to do that. So
Thank you.
Go ahead. Thank you. So
Yeah.
the training that you get leads you right into your roles. You get, as a chaplain, you get interfaith training. I'm a Methodist ordained as a Methodist. They didn't give me interfaith training. They gave me Methodist training. And when I left the Methodist and became Lutheran, they gave me Lutheran training. Your interdisciplinary trauma-informed care. The pastor, the seminary, and denominational formation, and an ordination that renders you some authority within a particular realm. You don't have to be ordained to be a chaplain. But many denominations, you have to be ordained to function as a pastor. And then a social worker therapist licensing appropriately. Skip?
Yeah, it even comes down in a practical way about even HIPAA. When I visited as a pastor of a church member, I've had, I take my badge off. I've actually had to tell staff when I walk out the room, they wanted to tell me the update. And I'm like, ho, no, I'm not here as chaplain. I don't have privy to their health information. That's a pretty important line to draw as well.
That's a very helpful example. Thank you. Yeah.
Can I ask a question? Skip just mentioned that, and it made me think of it, but that blurry boundary with like a medical and a chaplain, what about like an ordination boundary? Like, for example, if you're ordained in a denomination that doesn't allow gay marriage, and as a chaplain, you're asked for that, how would you handle that?
As a chaplain, I'm coming alongside that person and providing the spiritual support they need, period. In my denomination, might there be consequences? There might be.
Yeah. And I would think, obviously, it's important to step in the denomination that affirms and embraces you so you don't have that conflict. But it's real. I mean, it's real, and we live that world.
It's the more you tell the ordination committee what you're doing as a chaplain, yeah, you might want to say I'm a spiritual and emotional support. But you're absolutely right. Yeah. It makes a difference to be in a faith tradition that affirms chaplains and has an understanding of what it is. Oh, this is so easy. Alfredo?
I just want to add about the baptism for a Catholic, that anybody can do it in case of emergency. Even the aunt, any person doesn't have to be religious person to baptize in case of emergency.
Why
Can be a friend.
Why are you telling us that?
Because I have not a problem. I just have a mom who called me, who the aunt baptized, and they asked me how they gonna pursue with the Catholic Church. And I just told her, you go with the priest and the Catholic Church and tell them that you baptized in the hospital because it was an emergency. And they're gonna raise the little one because it was an emergency. And the aunt baptized the little one. And tell me if I am grown, Victor, because this is what happened right here in Samaria.
Okay, Victor?
Alfredo is correct. In an emergency, yes, anybody can. Then you report it and they register it and it's valid.
And what are when you both say anybody can, you are appealing to the fact that the Catholic Church will have some sort of recognition and acceptance of what has been done under the
Sure.
Yeah, that's important. That's the authority you're appealing to. Now that can be helpful as an instructional response to the care receiver if they have questions about, is this going to be valid? I certainly have been present when someone is dying and they have said, wait, you can't do last rites, can you? And then how can I affirm for them what I can do for them that their orienting system, their faith tradition will acknowledge, because I don't want to do harm. But it's not about whether or not I think it's okay. It's about whether or not they will find it to meet their orienting system's standard. What, does that make sense? Because I'm trying to come along. Very good. Okay, excellent. Thank you. Thank you both for that.
Still on that, I also had an experience where emergency baptism was done, and afterwards, I understand from a Catholic priest that in case that person survives, it's like there's an opening there that it can be, is it nullified or it can be redone? I don't know
That's
how
the wrong information.
like in case the first one was not in
That's the
place,
wrong
the second
information.
one can be.
Was that your experience, Jennifer? I'm
Yes.
appreciating Victor's fervent response. Share your experience.
Yes, this was my experience, my personal experience actually. I was there when the little baby was baptized, and then the parents were asked to also go to maybe to their parish or something like that. Then afterwards, I asked the priest who did that, and I think there's a provision, some certain kind of provision that in case of emergency, after it's done, if the person survives, I don't know how it's done. I may not remember the actual word he used, but it's like it can be. I know baptism cannot be redone, but that one sounds like it can be redone in case the first one was not well done or valid or something like that. That was my understanding.
Okay, and Jennifer welcomes Victor your reflection from your perspective.
No, there's confusion here. You don't put out such information. Baptism is not done twice. That's the principle. Baptism is not done twice. So there's no redoing.
Victor,
Once it's
let me
done,
push back a little bit. I'm a chaplain. The person has asked, they've been baptized, and they said, but I need to be baptized again because I was addicted when I got that first one, but now I'm clean and sober and I want another baptism. I'm going to do the baptism. So it does exist. That's the fact. But what you're navigating is what the orienting system or the tradition might have to say about it. And as a chaplain, I'm not bound to that. I'm bound to coming along beside the patient and having a conversation. So I may have the conversation. I have a good friend. His name is Victor. He tells me there's no two baptisms. Let's talk about it. But if that becomes what is their need, I would make that intervention because I'm not trying to meet the standards of their orienting system unless that is their priority. Yeah, you don't like that, Victor, do you?
I think we're saying different things here now. You know, Jennifer talked about a Catholic scenario, okay?
I'm in a Catholic scenario too.
No, it's not done twice in a Catholic scenario, okay?
Yeah.
So
well, let's talk about the Anabaptist. That's twice.
Can I say something too?
Yes, you can.
Okay. Theologically, I'm with Victor. Theologically, though, there are not two baptisms. Baptism is your initiation in Christ. However they call it, is not really rebaptizing. Theologically, there's no scenario you can justify that from a theological and biblical point to justify a second baptism. Once baptized, you're always baptized. Now, somebody can say, I wasn't aware, but that is not rebaptizing. It's some sort of confirming what has been done, but it's not theologically, again, this is chaplaincy. Maybe chaplaincy is not meant to be theologically orthodox, but it's not really rebaptizing per se, because you can be baptized twice.
I appreciate your clear articulation of your orienting system. That's what that was. That's your orienting system, your theology. And it may be faithfully representing some tradition, but that's what you articulated. Kate?
So sorry, I'm still just wrestling with this idea a little bit. I'm Episcopalian, it's very broad faith. There's a lot that doesn't have a problem there. But for example, take something so counter to a faith. And for me, again, I come from a real diverse background. There's a lot I don't have a problem with. But let's just use an extreme case of Santa Muerte. When you pray a Santa Muerte prayer, there's really specific language you use that goes against many Protestant traditions. And I myself am okay with that, but I'm thinking just about this idea you've put forward that a chaplain has to do a thing. And there's this ethical boundary that people have, regardless, they choose what they choose for a reason. And so as I'm listening, I'm really just trying to wrestle with that tension. And again, I don't see it so much for me, but I mean, I suppose somewhere up the chaplain chain, there's somebody who's willing. At what point can we just let a person or a chaplain, or as we think about this broader movement, say, I'm not okay with this, somebody else do it?
What the chaplain has to do is come alongside the spiritual care receiver and explore. They may want some adherence to some rules or traditions, or as Alice stated, orthodoxy. That may be what they need. And then the chaplain comes alongside them to help that come to pass. The chaplain does not allow their personal convictions to prevent them from serving a spiritual care receiver. And that is important because the line, once you abandon that authority to be a guest in the sphere of others, becomes very problematic. I was a part of a faith tradition that was homosexuality is an abomination. I don't bring that to my spiritual care receivers.
So maybe
so the ethical question, hey, how does one work through the ethics of that? You use your skills to come alongside that person. What is it that they are needing? And then you draw on some interdisciplinary support and figure out how you can serve them best. And you would have that in other contexts too. And you don't have to go way up the chaplain hierarchy. You're absolutely right. I would imagine you could have it as a police officer. I would imagine you could have it as a judge, and on and on. And so you reach out to have colleagues, you have consultation and conversation. How do I embody this? This is my orienting system. Can I name it? This is what I believe. There's not one baptism. And that's what the Bible says. Now, this is what they believe. Help me figure out how do I come alongside them. But I first have to kind of be willing to say, this is what I believe. That's it. That's your orienting system. And just kind of sit with that, like, oh, wait, I don't have universal truth that I get to operate from, not as a chaplain, but pastors often operate from the perspective of, I have universal truth. This is what it is.
So then maybe I understand it from how you modeled earlier when you shared a chaplain piece and then you shared a trauma-informed follow-up. A person has to do a thing that goes against their ethics. They're going to carry that with them in a unique way. So as a peer or a chaplain or a manager or something like that, maybe a better thought, just to help me think this through, is to do what you did and say, I know that must have been a really hard thing for you to do based on these other things that I know. Let's talk about it. So it's kind of like a secondary level.
Yeah, I think the language of goes against their ethics is your language, not mine. It simply went against, not simply, it went against the rules of their tradition. And so they thought immediately, I can't do it, because they didn't step out of that role. But when invited to step out of it, actually they were enthusiastic and went forth. But I absolutely agree with you. When you add, hey, but what if it is creating some sort of emotional or spiritual crisis within that person? I agree with you completely, Kate. Let my trauma-informed care kick in. How do I come alongside that person.
Thank you.
Excellent. You still with us, Alice?
I am still there, but I know that, first of all, if a care recipient asks me to do that, I will not even have a conversation, this tradition or not tradition, I will do that. If they ask me to baptize them, I will do that. That's fine. But in my heart, I am not thinking of baptism. I'm thinking of confirming what they already did. And I think in my heart at that point, I don't need to get to saying this is second baptism to be able to do. I won't even have that conversation because I think it's not a place to have the conversation. It's just walking alongside. But in my heart, I'm not going to erase my father. I'm a theologian and biblical scholar. I do that for my heart. I'm going to do it as Lord, confirm this person's baptism, but I'm not going to think in my heart that that is second baptism. For the other, she will not know.
I want to invite you to, I appreciate the energy you're putting in and assessing your own orienting system to figure out how you would come alongside someone. I appreciate that. I want to encourage you to not let that prevent you from assessing their spiritual orienting system and whether or not it matters to them if they adhere to some rules of their tradition that they may not be aware of. So don't prioritize, I got to get myself right to do it. No, I really want to understand what matters to them. Because if it matters to them that they not be baptized by a Black woman, because that's not acceptable in their tradition, then I want to know that and come alongside them to get what they need and not spend all my energy trying to figure out how to, all of it. I can have some, this is what I need to be able to do it, but what do they need? Because you might figure it all out for you, but not realize it's not figured out for them. And they didn't know. That chaplain tricked me. I didn't even know I wasn't supposed to do another baptism. Well, wait a minute. That's what you asked for. Because what they say is not enough. I have to continue to explore so that I can understand. Does it make sense?
Absolutely. I appreciate that. But I'll keep my conviction though. It's not because sometimes we think you have to let go your conviction in order to get into the other, right? I will do all of that, but I'll still keep my conviction though. I'm
I
just being honest.
appreciate that, and I'm going to keep the end of this didactic and invite us into a break. Thank you so much for your participation. I do love something. Go ahead. Take your break. Please come back. It's 3 o'clock for Joseph.
Okay, let's take 7-minute break.
Yeah.
Okay, let's regroup. You're almost there. You're doing a great job. Do you see the goal line? After this didactic, we'll be done 2/3 of the orientation. How about that? Be positive, hopeful. Yes, you can do it. Okay. Get this energy level up. Okay. I'm blessing you from here. Okay. Bless your Jim and Kate. Yeah, that's a good idea to drink it. All right. James, Alfredo, Ram, Audrey, Alice, Victor, Skip, Jennifer. Okay. I bless you. Okay. Hang in there. Next hour or 2 hours, or depending on how you cooperate, I can make it shorter. How about that? Isn't it good news? Yeah. It could be 2 hours or it could be hour and a half, depending on how you cooperate. Okay. There's some hint. There's some
You're
hint.
moving the goalpost.
Okay. Then I'll stick to the hour then. Make your dream wish come true. Stick to the schedule then. All right. So please check your email. I just sent you an email with your test results, so you can see how you can understand your test score. Okay. So check everybody. I want everybody to check your email. Okay. Is there anybody who did not receive? Okay. I'll assume everybody received. Okay. All right. Good. So, for the next didactic, I want to share this didactic about a personality test or personality theory. There are many, actually, there are many personality theories. I've been teaching this class at seminary for DMin students, and there's a book that we use for as a textbook. And the textbook introduces 26 personality theories. And that's just not all of them. Okay, so there are many personality theories. But today I want to introduce to you this very simple, one of the original personality theories, which is called the four temperament theory, four temperament personality theory. From this, scholars developed all other many personality theories like DISC and the MBTI. Okay, so all those, and there are some other tests. They are originated in this four temperament personality theory. Today's the theme of this unit, as I said, is about personality-oriented pastoral care. In other words, we need to know this personality theory so that we can understand how we communicate in different styles because of our different personalities. Does it make sense? So when you meet with somebody, some patient who has different personality type than yours, then you communicate different ways. If you stick to your own ways of communication, probably it won't be as effective. And also, trauma-informed approaches should be different depending on the care recipient's personality types. Okay, so this affects 1A13, 1B13, 2A12, 2B10. It also affects how you do your self-care. Different personality types need different kinds of self-care. Okay, isn't it interesting? 1B9. Also, this helps you understand how you usually form your empathy statements. Depending on your personality style, personality types, you prefer to use different types of empathy statements because of your personality type. But if you meet again with a patient with different personality type, you want to offer different empathy statement appropriate for their personality type. This also has a lot to do, influence a lot on your power dynamics and how you recognize and claim your authority. Different personality types want to claim different types of authority and different kinds of the power dynamics. It also affects how you assess spiritual assessments. Okay? Because different personality types need different spiritual needs, have different spiritual needs. Have you thought about that? And as a result, you choose different interventions depending on your personality type. How can you make it appropriate for the care recipient's personality type when you choose interventions? This also has a lot to do with how you receive the feedback from your peers. Yeah, according to the different personality types. And also how you offer feedback, okay? See how personality theories and personality types can affect this many areas. So what is about for temperament test? It was originally presented by Hippocrates, okay? 2500 BC in Greece. He was not just a philosopher. He also coined this idea of classifying human personality types depending on 4 different fluids in the body. I'm not saying this is scientific, but he used this terminologies to classify human personalities into 4 categories. So he named actor type or actress type as sanguine, okay, has to do with the blood. And also he also named director type as choleric, goal-oriented. And then he also classified the art director or a sound system person in the theater as melancholic. Okay, these are the perfectionist. And also classify the audience type as phlegmatic. The word comes from the phlegm. Okay, so when you go to the theater, drama club, you see 4 different types of people there. There are actors, there are director, there are art director, and then sound system guy, and there are audience. They have a different personalities, right? So I think that's easier way of remembering the classification. So why and how we can use this in providing pastoral care? So depending on the personality types, you need to use different languages. When you go to Germany, you need to speak German. When you go to France, you need to speak French, right? So depending on the personality, you want to use different languages. What are those languages appropriate to speak to different types of personalities, to your patients and staff? And also, you need to know this to better assess and meet the needs of the care recipients. And also to better understand your behavior pattern. Why am I interested in specific patients or specific staff? Why do I tend to monopolize the space and time by just never stop talking? Also, you want to know this to understand how to build, maintain, restore relationship, depending on appropriate to the personality type. And I want you to remember this. This is not a scientific test. This is called preference test. All the tests that you guys know and are familiar with, like Enneagram, MBTI, DISC, 4 temperament, most of the personality tests that you all know, more than 90% of those, they are not scientific. They're called a preference, meaning that today's test result can reflect your nurture, your nature, some of your big life events, and today's feeling, okay? Mood swing, whatever that is. So this tends to change all the time, okay? So there's a preference included. If you want to take the scientific test, that can tell not only your personality, but also your pathology, psychological pathologies, you need to take MMPI. Okay, I think you heard about this, Minnesota Multiphasic Personality Inventory. This is scientific inventory that can tell how many of your answers, how much percentage of your answers are wrong or false. They can tell you with that. It's very scientific. And also, please don't forget that there's no bad personality type. There's no such a thing. Okay. After giving and taking this quiz, a lot of people ask me, so do I have a bad personality? No. There's no such a thing. Don't you worry. I'm giving you a supportive comment. You'll be all right. And don't forget that my personality type shifts according to my energy level, major events, and physical emotion environment. Okay? So that's why I want you to take 2 different tests, strength and weaknesses. When your energy level is low and when you're stressed out, you tend to show your weaknesses. And then many times there's a shift between your strength, your personality type when you're healthier, and then in good mood, and then when you're stressed out. There's a little bit of shift usually, okay? All right. Any questions so far? No. Okay. Now let's jump in. This is exciting part. Yes. All right. I want you to have a look at your own scores in the email that I sent you. Remember that score. All right. So this is the scores of you guys. There's no specific order. I just put down the results as soon as I got the results from you guys. So there's an Audrey, there's a Jennifer. Okay. All right, Audrey, let me explain this to you. So whether in strength and weakness, you do not shift. You're pretty much the same type you have. And then when you are not stressed and in good mood, you're choleric sanguine, and also when you're stressed or your energy level is low, you still are choleric sanguine. And in weaknesses, it's the same score. So choleric equals to sanguine. Okay. So in strength, your primary trait is choleric. Secondary is sanguine. Okay, so that's your type, choleric sanguine. And weaknesses, still choleric sanguine. Remember that, okay? Jennifer, where's Jennifer? Okay, so when you are in good mood and healthier, not stressed, your personality type is phlegmatic, melancholic, or phlegmatic sanguine. The same score between melancholic and sanguine, okay? So remember that. When you're stressed, just a little bit of shift. You become sanguine, phlegmatic, or sanguine, choleric. Because there's a same score between phlegmatic and choleric. That's your type, okay? That's your primary and secondary. Remember that. Skip. Where's Skip? Oh, right there, okay. So Skip is very strong in sanguine when you are in good mood. Energy level is high, very strong, 12. And then the secondary is choleric or melancholic. So your type will be sanguine choleric or sanguine melancholic. Okay.
Mm-hmm.
And then when you are stressed, you still are sanguine choleric, but the sanguine number it decreases in mid-grade scale. So they're equal. Victor, where's Victor? Victor, right there. Okay, yeah. Hi, Victor. So Victor, make a little shift between strength and weaknesses. So when you're not in stress, your type is melancholic phlegmatic. Okay, melancholic 9 and phlegmatic 8. That's your primary and secondary. Remember that, okay? And then when you're in stress and tired, there's a little shift and you become phlegmatic melancholy. Okay, phlegmatic melancholy. All right, remember that. Ram, when you're healthier, not in stress, you are melancholic, phlegmatic, and choleric. There's not much difference between phlegmatic and choleric. So that's in that order. Melancholic phlegmatic. And then when you're in stress, there's a little shift, and then you become cleric melancholy. Okay, remember that. I'll explain later. Jim? Jim is the same. Whether in strength and weaknesses, you're the same. You are melancholic phlegmatic, but you're very strong melancholic. Very strong. Okay, so remember that you're very strong melancholic. And 80 is still high for phlegmatic. So you're very strong melancholic, very strong phlegmatic. Remember that. So you don't have much sanguine or cleric. That's the something that you want to remember, okay? Kate, you're very balanced. You're everywhere, like so balanced. So when you're in strength, you are cleric melancholic, but you still have some phlegmatic. And then in weaknesses, you are cleric melancholic and phlegmatic. Okay. So there's no scientific background of my comment about this. So I've been giving this quiz for the past 15 years, and this is from my experience. So usually when I see somebody who come with these results, there are two backgrounds. One, they might be very well balanced and so mature in terms of their personality. Very mature person like you, Kate. Yeah. And the other kind, or possibility, is that they might be melancholic and they kind of balance it out on purpose, but I don't see that in you. Does it make sense? Yeah. Yeah. So I think I see you as a very balanced. But anyway, so remember that. And then Alfredo. Alfredo is a very strong cleric. You have 11, very strong cleric. Skip is very strong sanguine, you're a very strong cleric. Okay? That just stands out. And then your type is cleric melancholy or cleric phlegmatic. When you're in weakness, cleric goes down, but still you are cleric phlegmatic. Okay, just there's a slight shift. Remember that. Alice, where's Alice? Okay, there's Alice. Okay, so when you are not in stress, you are melancholic sanguine, and phlegmatic. You have some phlegmatic too. Melancholic sanguine or melancholic phlegmatic. When the energy level is low, there's a slight shift, and you become cleric melancholic. But you still, I think your primary would be melancholic. Okay, melancholic cleric. All right. So what does it mean? So let me explain this to you. Now, we'll do some exercise. If your primary trait, if your primary personality trait, meaning the highest score, okay, in strength area, in strength field, is sanguine, raise your hand. Yes, Skip. Yeah, that's right. Anybody else who has a sanguine as a primary? No. Okay. If your high score in the weakness part is the highest is sanguine, raise your hand. I think Alice, isn't yours highest in weakness? No, you're not right. Okay, so, oops, this is very interesting. Okay, Audrey, your high score in weakness is sanguine, but I think your primary is cleric. So I assume that Skip, maybe you are the only one who has the high score in the sanguine part. Okay, so we're going to. Oh, Jennifer, you too?
Yes, I think that's my highest score.
Oh, that's right. Yeah, yeah. The high score is,
Weakness.
yeah, high score is
Yes.
sanguine. That's right.
Yes.
Okay, that's right. Yeah. So we're going to see Skip to demonstrate what sanguine personality is about. Okay, Skip, I'm going to ask you to stand up on count 3. Is it okay with you?
Mm-hmm.
Okay, all right. So you ready? So I'm going to count 1, 2, 3, and then you stand up. Okay. Okay. 1, 2, 3. Stand up, please.
Woo!
Oh yes. Sit down, please. Sit down, please. Okay. Do you see that? Do you see that? The Skip is demonstrating so many characters about sanguine. Sanguine is an actor. Okay. They love to draw attention. They love to stand in the space where there is attention. Okay. They're actors or actresses. They're such a wonderful colleague, and they become a good parent. They have such a magic to be able to change the atmosphere with one word or one action. Such a wonderful trait. They love to talk. They love to perform. Usually they are talkative. And that usually, I'm not saying you are, Skip, but usually. And then they have some tendencies to not to be able to remember people's names very well. Is it true with you, Skip?
Yes. Well, if you're in front of me, but not after you're in front of me.
Right.
Yeah.
So sanguine people tend to remember people not by names, but by their clothes, colors. So they're very sensitive to colors and shapes. So maybe in some month later, year later, they may not be able to remember your name, but they still remember you with some sort of images about you. Is that right?
Yes, and their story.
That's right. Their stories.
When they start talking about family, it comes back.
Right. Yeah. Yeah. So the stories, images. Okay. Okay. So sanguine people have a lot of friends because their life goal is to have friends. So sanguine people are so much into relationship. Okay. So let's make a scenario. When Skip, I'm not saying you are doing that, Skip, but many sanguine personality type chaplains tend to make mistakes when they enter into patient room, regardless of who they are. They tend to like to ask them about the patients about the relationships, especially with the family and friends and then support system. Why? Because they are really interested in friends and relationships themselves. I'm not saying you're doing it, Skip. So because of this, so if you are aware of your personality type and your tendency, it'll help you not to be blinded by that tendency and stay focused on listening, actively listening to the patient's story until the end and figure out what they truly need from you. Does it make sense? Okay.
So perfect. Yeah, so spot on.
Yeah, yeah, yeah. So that's how you use your personality theory and your understanding by theory. When sanguine people are not in good mood or they're not in good, high stamina, high energy level, they tend to litter around, scatter around things. So they're not necessarily strong in organizing. I'm not saying, don't take me wrong, I'm not saying Skip is doing it. Okay? Skip is good at organizing too because his secondary character is melancholy, who's organizer. So, and then Skip has a benefit from it. Okay, so on one hand, his tendency as a sanguine can be like, I want to just get around, just be on my own free. I'll just live my free life. And then the secondary trait is organizer. So these type of people can develop the behavior like they tend to raise their hand at the beginning. They're so amazed by these new thoughts and new people and new ideas. They raise their hand. I want to be it. And then soon they regret. Why did I do it? And then if Skip is only sanguine, he'll just disappear soon. But because sanguine has a secondary, which is organizer, he can leave. He cannot leave and stay there and stick it out and complete it. Does it make sense?
Yes, get out of my head.
Yeah.
That's very accurate.
Yeah. Yeah. So that's the benefit of having kind of opposite traits at the same time. Skip has that tendency. And then also Skip has the cleric, which is goal-oriented. Again, after he raised his hands, he doesn't leave, he stays there and completes it. So that's a benefit for you, Skip, because you can understand the actor, you can understand the perfectionist, you can understand the goal-getter. So good character to be a chaplain. But I still want you to remember what tendency or behavior pattern you might have as you enter into the patient room. Why am I interested in asking these questions? Okay, does it make sense?
Yes, very much so.
So this is for everybody. So you walk into a patient room. Can you communicate with them well? What can be the language to speak with sanguine people? Skip, do you know what kind of language?
It would be language of like, who are your friends? Tell me about your family.
Yes.
It's engaging and
Right.
it's active. It's
Right.
voice. It's movements.
Right.
It's that space that's theatrical in a way.
Yes, theatrical. I love the word theatrical. So sanguine people are very much into something theatrical, new, right? Active, energetic. Okay. So when you meet with a patient who has a strong sanguine tendency, even though you're not, remember what they're really into and try to listen to their needs because it's their needs. And so in addition to that, the friends language, relationship language, another language that really fascinates them is praise. They love to hear praises. So let's say Skip heard 100 praises a day. Are you ready to hear another new one, 101st praise? Or are you sick and tired of them?
No, more would be okay.
Yeah, see, did you hear that? This is sanguine.
Awful.
This is sanguine. So when you meet with a patient with a sanguine tendency, you continue to praise them for what they did good. That's how you communicate. Okay? Talk about family, friendship, something new and energetic and active and theatric, and praise. Okay? That's the language you want to use with sanguine patients. Remember, I know that's not your language because you speak English and they speak German. But to be able to have the appropriate assessment, you want to speak their language, if that's what they want, okay? So this is how you use personality theory. So that's sanguine. Good. All right. Any questions so far? No. Let's move on to the second column, which is cleric. Cleric is the director, okay? All right. Okay, I know Audrey. You're the cleric. You're the cleric. If you have the high score in the the strength area as cleric, the second column? Raise your hand. Okay, Audrey has. Okay, all right. Audrey, I'm going to add, Alfredo, you also has a high score in cleric, right? Okay, all right. Audrey and Alfredo, I want you to be ready to stand up. So I'm going to give you count 3, and then I count 3. I want you to stand up. Audrey, are you ready? Okay, all right. Okay, all right. I'm going to count 1, 2, 3, and then please look at these people and then watch carefully about how they stand up. Watch very carefully. Okay, 1, 2, 3. Stand up, please. Okay, sit down, please. All right. Did they stand up in the same way as Skip did or not? Or very differently, right? How differently? Any observation? Any observation? It's very different. How did they stand up differently? Kate, Graham.
Pretty
I stood up
vertically.
because,
Sorry.
yeah. Sorry, Kate, sorry, go ahead. No, Kate, go ahead.
Oh, sorry. I thought he said my name, which is why I spoke.
Yeah, go ahead. Yeah, go ahead.
They stood up very vertically with their hands at their sides.
Yes, hands on their side and vertically. Versus Skip was like, okay, so there's no facial expression, right? Skip was so happy, like moving the body, and they just stood up vertically and hands on their side. Versus Skip was like, okay, Ram, what else did you watch?
Well, Skip was delighted to be told to stand up, whereas
Yes.
Audrey and these people were standing up because you asked them to.
Yes, they did not necessarily want to stand up, but you
Right.
asked me to, so I will stand up for you. How dare? And it's written on their face, on their posture. So let me do some again. I'm sorry, Audrey and Alfredo. I'm not talking about you, okay? I'm talking about the ordinary, regular type of cleric. I'm just making a little bit of exaggeration. Okay, I'm not saying you did this, okay? This is just only for the sake of education. So this is,
Okay.
yeah, this is how they stand up usually. Okay, look at me. This is how clerics stand up. See? So what message am I giving out by this? What message am I giving out?
I'm in charge.
I'm in charge. Yes, you knew what you did, Audrey, by standing up that way. Who else said something? Somebody else said something.
Like you're assessing.
Yes, they're assessing you.
Yeah.
I'm watching you.
Measured.
I'm in charge. Yeah, what else?
Measured, controlled.
That's right. I'm in control, not you. I'm in control. I'm in charge. Okay. I just want to make it very sure, very clear. I'm the boss. I'm in charge. I'm in control, not you. Don't you dare ask me to stand.
Self-aware.
Self-awareness. Yes. I'm very aware of myself as the boss. I'm the boss. Just in case you forgot, let me show you who's the boss. So sanguine is a boss by Nate. They're born to be boss. That's how they see themselves. They are the director. Sanguine people have a lot of friends.
Language
Yeah.
changes.
Yeah, sanguine people have a lot of friends, but cleric have not many friends. Why? They don't need friends because they have a confidence that they can do whatever by themselves. I don't need any other manpower or support. I can do anything just by myself. If the airplane that I'm in make a emergency landing and then dropped on the desert, just give me a week. I have a confidence that I will make a motorcycle and I'll just come out of the desert. I have a confidence in that. Audrey, am I right or wrong?
You are so right.
This is cleric.
You are absolutely right.
Yeah, they have a confidence. I don't need any help. I don't need any hands because I can do anything just by myself. Why do I need support? Why do I need friends? So they're happy by themselves. Yeah. See the difference? So the goal of Skip, the goal of, I'm sorry, it's not Skip. Goal of Sanguine is friends. Okay? That's their life goal. The goal of life for Cleric, it's not friend. It's not relationship. It's accomplishment of goals. They want to accomplish goals. Okay? See Alfredo nodding? See that? Yeah. How do I know Alfredo? How did I know about you, Alfred? I'm not talking about you. I'm talking about clerics. Clerics, unlike Sanguine, do not say a lot of words. See, Audrey and Alfredo usually go taciturn and quiet. But when they speak something, you better listen to them because they speak the truth. You better listen to them. So they put a lot of weight in their saying, in their words. Yeah. Surprisingly, even if they do not have many friends, they still have friends. And usually I'm not talking about you, Audrey and Alfredo, okay? Don't take me wrong. Usually those friends surrounding these cleric people, at the deep level, they're not really friends. They're assistants. Because some people insist to be around clerics, and Audrey and Alfredo, cleric people say, it's okay. I don't need kind of support. But if you insist, come under me. Okay. So be careful about when you're invited, when you're accepted as a friend to cleric people, and think about what they mean. Did I read your mind right, Audrey? I'm sorry to read your mind.
I promise you. You did.
I don't know how I read your mind.
Dead on.
I'm not talking about you, Audrey. I'm talking about clerics. Okay. So when they're not in good mood or when they're in stress, cleric tends to be cold and authoritarian. And they may hear the comment about this from their friends or surroundings. So you want to pay attention to them. So Audrey and Alfredo, when you go into a patient room and happen to meet with patients who are sanguine, you want to pay attention to your personality type, okay? Who's not really interested in a relationship or friends, but think about who they are. They want to talk about friends and relationships. Then you want to speak their language. Does it make sense? Even if that's not your language. That's how you use your personality theory. Okay. When clerics are around you, what kind of language do you want to use for clerics? So when your patients are clerics, this is for everybody. When you want to approach people like Audrey and Alfredo, if they are your care recipients, you do not want to praise them because praise does not make a lot of sense to clerics. Do you know why? They know I'm good. They already know I'm good. Okay, so they don't need any praises. What works for them, listen very carefully. What works for them, the language that really works for cleric people, is actually challenging them. So when you want somebody like Audrey to support you, to do something for you, this is how you say, Audrey, oh, you look kind of tired today. Are you sure you can do this? I need some help with this, moving around this, tables, but I'm not quite sure if you have some energy left to do this, because you look kind of tired today. Can you do this, Audrey? How does it make you feel, Audrey?
like I'm probably gonna help you move some
Yeah,
papers.
see, did you see that? Did you hear that? Did you hear that? Do you know why? Because Audrey wants to prove that I can do it. You challenged me. How dare you challenge me? Let me prove and tell you I can do it. See how the language should change? For sanguine people, don't challenge. They'll be mad at you. I don't like you to challenge me. I want you to praise me. Okay? But for cleric, a little bit of challenge actually that works for them and actually help them to get more innovative. Isn't it interesting? Alfred Nas. Oh, Joseph, how did you know about me? I'm not talking about you, Alfred. I'm talking about clerics. Yes. Okay. And then when you meet with patients with a cleric personality, you want to talk about goals, accomplishments. Does it make sense? Because that's what what they're interested in. So sanguine people enter into this patients with clerics. You don't want to talk about friends because they're not really interested in friends. Yeah, they're interested in accomplishments. Even in the last stage of their cancer, they want to talk about what they can still do, accomplish. Good. All right, let's move on to the third one. I know there are a lot of melancholics. If your high score in the strength area is a melancholic, raise your hand. Yes, we have a lot of melancholic. All right, so melancholic people, I'm going to ask you to stand up on count 3. Are you ready? Are you ready? Okay. All right. Victor, are you ready? Okay, I'm going to count 1, 2, 3, and I want you to stand up, okay? 1. Look at these people. They stand up very differently. Watch carefully. 1, 2, 3. Stand up, please. Yeah. Okay. All right. All right. Did you see that? See? They stand up differently, right? Did you see that? How they stood up differently? Anybody guess? Let me see how carefully you watched. Let me show you one more time. What?
Well, I was going to say, I noticed most of their arms were up.
Yes.
Like
Most
they
of them
stood up and
yeah,
their arms
yes.
were up. Yeah.
Close together. Yeah. What were they doing by doing that? What's happening? Why did they do that? Any guess?
No.
All right, Jim. Jim has very strong score in the melancholy. So let's watch Jim one more time. Jim, would you step away from the screen a little bit so we can see your whole body? That's right.
Yeah.
That's right. Okay. No, not yet. Sit down, please. All right. Okay. All right. Okay. Count 3, you stand, okay? 1, 2, 3. Stand up, please. Okay, so all right, you can sit down. Now that we talked about it, he just purposely
He didn't do it.
Now we talked about it. So you guys are right. So let me do a little bit of exaggeration about how usually melancholy people do. So this is how they stand up. Look at me.
Yes, they did.
They did, right? Yeah, especially Ram. Ram did like this.
Right.
I
Yeah.
wonder if Ram remember this, but yes, you did. Okay, so what were they doing? And then so did Victor. Victor was also doing like, what were they doing? What were they doing with that? Any guess?
Trying to show my six-pack? No.
Even though Ram cracked a joke, actually that is the right reason. They do not want to look not perfect. Even in the middle of this, like a small presentation, they want to look as nice as possible. So they just keep themselves tidy and just be prepared and to look nice. See, Victor, how did I know? I'm sorry. Yes, I knew about, not you, but I knew about melancholics. Every second, each second, melancholics are so much aware of how they look, how they might be considered. They want to look nice. They want to be judged and assessed nice and perfect. So the life goal of sanguines and friends, the life goal of clerics is goals accomplished, right? The life goal of melancholics are not goals, are not accomplished, are not friends. You know, their life goal is to be perfect, to live perfectly. Sanguine, for sanguine, here and now, my friends who are right next to me here and now, it matters most. Clerics, their future goal matters most. They will accomplish it no matter what. For clerics, the process in between here, now, and the future, that matters most, the process. So when you talk with melancholics, be prepared to explain each and every step. Okay, they're very logical, melancholic. So if you lose a logic, if you like a skip in the middle of something, they get mad. Am I right, Alice?
Yeah.
Jim? See, look at smile. How did you know? Yes. This is Ram, see Ram, and then Alice and Jim. Yes. They're mad if you skip a step. Don't you ever skip anything, because you have to say and go through every step, because that's what matters. It's not about the result. It's about the steps you've gone through. So when you meet with a patient with strong melancholic, okay, you better try not to skip anything. You have to explain every step about why you ended up here in this room, for what purpose you have come today. You have to explain everything in detail, because that's what matters to them. Versus, so you're melancholics, you enter into patient room, happen to be sanguine. They hate to hear steps. They want to hear bottom line. See, Skip nodding?
Yeah, get to it.
Yes, just get to the bottom line. I don't want to waste time hearing all the steps. You see how you approach differently? Your tendency is to go through every step. So while you explain every step, sanguine patients are bored. They start yawning. They want you to tell them bottom line. See how you change your language? Your assessment should change depending on the personality too. Okay, this is very important for you to notice, because they are not the same as you. They do not speak the same language as yours. Melancholics tend to be very conscientious. They hate to see and hear people telling lies. So when you enter a patient room, the people with some memory, yeah, Jennifer is laughing. When you meet with a patient with some memory loss, or some who tends to speak very kind of bubbly about their own life story, in your heart, you may start making judgments, because you hate to hear lies. So you tend to make judgments in your heart. You're very good at make judgments very quickly. So remember that tendency in your heart because of your personality character. So how can you go through that barrier and stay focused, not making judgments, and stay curious about where they are? Does it make sense? All right. And because melancholics are perfectionists, not because they are less effective or less performing, but in comparison with all other personality types, melancholics tend to have a lowest self-esteem. Did you hear that? Even though I said at the beginning that it's not true, that your performance is least or you're not as good. Okay, that's not true. But because of your tendency to be perfectionist, your self-esteem tends to be so low. So you guys need to continue to check with your peers and get their feedback about how you're doing, because you need to continue to hear from them, that so that you're not doing poor performance. You're doing, actually, the reality is you're doing great job, because you're so conscientious to yourself and to others. You never stop working. You're doing great job. Okay, don't you ever forget that. All right, Skip.
Yeah. So is the melancholic, are they more the artists, the individuals?
Yes. Yeah. So they tend to be artists.
Perfectionists
Yes,
that
they're
doesn't like their
perfectionists.
art, but they
Yes.
keep doing it.
Yeah,
Okay.
they're very good at art. Very good. So they tend to be some sort of artist, good at writing, good at numbers, painting, sculpture, music, also all different kinds of arts. They're artists. They're very sensitive to the detail. They tend to be very caring to the detail. My wife is very strong melancholic, and she is loved by the residents. She works at the nursing home, and the residents love her. They adore her because she's so much in detail and caring. They love her. And she's a nurse as well. And melancholics are good at organizing and cleaning. So this has to do with the self-care. Have you ever thought about doing the dishes becoming your self-care? Melancholics couldn't do that. Did you see that? See, Jim making smile. See? Can you believe? Doing the dishes can be also Alice. They like cleaning and organizing, doing the dishes so much that it becomes their, yes, Jim, go ahead.
Cutting the grass.
Yeah, cutting the grass. Yes.
It's my thing.
Yeah. So for me, I can't understand how cleaning and doing the dishes can be your self-care. Oh my God. Then my wife does that all the time. So I was like, I can't believe, how could you do that? But she does.
Washing the dishes has become my thing.
Yeah.
Yeah.
My wife should hear this. I don't like to use the dishwasher. It's such a beautiful mindfulness exercise.
See, did you hear that? See? Did you hear that? Yeah.
Each time, each prong in the fork needs to be tended to with attention and care.
Right? see how different language you use?
I even calculated. I use a lot less water by gallons than dishwasher.
Oh my, look at this. So they love to talk about this calculation. They love calculation. See, he even used the word calculate, this typical word for melancholics. They love perfection. They love numbers. They love organizing. Yeah. See, Jim just can't stop laughing. This is my confession, Jim. As you did confess, I'm going to confess. So one of my trait is sanguine. So I love to litter. Okay. So I'm not talking about, I'm doing this, in the current time. I used to do this. Okay. Not anymore. I can't do that after 34 years of marriage. So I used to litter as I come back home from work. So I just got the front door closed, and I just take off my jacket, just throw it on the couch, take off my socks, and put it on the chair. Okay. And then the shirts and then I take off somewhere else. Do you know what my wife does? She follows me and chases me and collecting all those items. She's coming after me and collecting. So I litter around and she collects. What a wonderful combination God put us together. Yeah. But don't take me wrong. I can't do it anymore. Okay. How dare. How dare. So I want you to remember this. Jennifer, you like it so much. Now, Jim made a confession, so I did too. I married a melancholic that sends me a monthly expenses. Yes, how about that? Yes, they're so good at that. They're good at calculation, remind you about that. and they are conscientious and they help you to be conscientious. Honey, don't you ever, honey, you spent a little bit this much. This
You know how much you spent on Amazon, but we needed it.
Yeah. So why am I saying this? Because I want you to remember when you walk into patient room, you have to understand it's very plausible that you will meet different personality type, in which case you have to speak different language because they totally speak different language. Even though they look like all Americans, they speak English. There's nothing is communicating happening here between him and you and her and you. Does it make sense? Unless you pay attention to the person. It's not the same language. It's not the same English. Lastly, one last thing. For sanguine people, you need to speak the language of praise. For clerics, you need to speak the language of challenge. For melancholics, don't you ever praise. Because when you praise them, they start having doubts and skeptical inside. Why is he praising me? See, smiles, James making smile. When they hear praises, they say, oh, something's behind this. There's something he wants from me. That's why he praises me. See difference? See the difference? Don't you ever praise melancholics. It actually aggravates the communication relationship. Okay? Skip, you're muted.
Well, what the heck do you tell them then?
Oh, that's right. That's where I'm getting at. So, and then don't you ever challenge them. If you challenge them, it'll crush them because they have a low self-esteem anyway. So on top of that, if you challenge them, they will just, they'll be demolished. Don't you ever challenge them. For melancholics, the language you know use is to acknowledge. Saying you're right. One of the best language they really want to hear in their life is the word, you're right. So when you want to communicate in depth from your heart with Jim or Victor, you want to say, oh, Victor, this morning you talked about this and that. I think as I look back, I really liked this specific part of what you said. I think it makes sense. I think you're right. And they feel like, oh, all those efforts that I poured to think about it and to do the research on that is recognized, finally. And they love to hear that. Does it make sense? Because they have worked so hard to make it happen. Nobody knows how much they have worked behind the curtain. Usually melancholics don't want to show how much they worked behind the curtain. And when it's recognized, acknowledged, they feel so much rewarded. So recognition, acknowledgement is the language for melancholics. Is that right, Jen? How did I know? Right.
Yes.
That's right. Don't you ever challenge melancholics. Don't you praise. They'll go skeptical. Joseph is praising me. Maybe he wants something from me. Okay. Okay. Remember this when you meet with melancholic patients. All right. Lastly, if your high score is phlegmatic in sanguine, or I mean the phlegmatic in your strength, okay? Raise your hand. Kate, you never raised your hand.
I had so many, I didn't want to stand up for all.
All right. I think you're more like a melancholic, but okay. So phlegmatic high score, raise your hand. Okay, Jim, Jennifer. Okay, I'm gonna give you guys a chance to stand up. Okay, since I had Jim. Kate, you never stood up, so I'm gonna give you a chance to stand up anyway. So look at Jennifer and Kate, not Jim. Jennifer and Kate, look at them. Stand up. You ready? On 3. Okay. Oh, Jim. Oh, I'm sorry. Jim, your high score is the phlegmatic, not melancholy?
It was 8, so I didn't know, like, but yeah. Melancholic was 10. My
Oh,
highest
okay.
score is
So
10.
you're more
Yeah.
like a melancholy. Okay, all right.
Yeah,
So
yeah.
Jennifer and Kate, I'm gonna ask you to stand up on count 3, okay? You ready? 1, 2, 3. Stand up, please. Okay, sit down, please. See? See the difference? You see the difference? Okay, what is different?
Just up and down,
Yes.
up and down.
No extra movement.
Exactly the same, like they both stood up
Yes.
exactly the
Yeah.
same.
Just seamless standing up and seamless sitting down. There's no need to make them tidy or like look nice or like trying to give a message, I'm in charge. They have no need to do anything. They have no motivation to change everything or to do the message anything. They're so simple, very simple. They're more than ready to stand up anyway. This is phlegmatics. Okay. Phlegmatics are more than ready to help you before you say it. Very supportive. Phlegmatics have a lot of friends. Sanguine has a lot of friends because they want to talk to, right? Phlegmatic has a lot of friends because they want to listen to. They love to listen. Yeah, they love to listen. So the typical posture that phlegmatics have in a group is exactly what Kate does right now. That's a typical phlegmatic posture. So what do they do with that posture? They listen to you. And what's happening in their mind as they listen to you and watch you? Watching you is their hobby. Isn't it interesting? So Jim has a kind of similar posture because he's phlegmatic as well. He's watching you, Kate is watching you. See what they're doing with this? They are scoring you. They're giving you grades. They love to watch and they love to collect data. They have so much data behind it. See, smiling, Kate, smiling, please do that. They never forget about what you did and what you said. They have a long list of data for the past years. So when you say something different than before, see Jennifer smiling? How did I know you? Jennifer. So you can tell lie before them because they are the judge. They have such a long list of data about you. They know what you did last summer and the summer of 2 years before. They know everything about you. Don't you ever try to disguise before me, because I know everything about you. Today, your performance is B. Yesterday was C. You should do better tomorrow. That's what they're doing as they watch you. They're very good at watching and they're very good at observing. That's why they're called audience. It's their role. Surprisingly, out of those four personalities, the highest self-esteem probably clerics have. The low self-esteem probably melancholic. Not because they're doing bad, but because they're perfectionists. Sanguine has self-esteem going up and down. It's circumstantial. It's up and down. See, am I right? Someday it goes up, someday it goes down. In the meantime, the self-esteem of phlegmatics, not as bad. They have very healthy, strong self-esteem inside. They just don't want to talk about it. They're very self-supportive. They're just self-satisfied. Don't be fooled by the phlegmatics. Just because they don't say a lot doesn't mean they have a low self-esteem. They're very smart, very high self-esteem. They have a very solid and healthy judgment and discernment in their mind. They're very supportive to you. So even before you ask, they're ready to help you. Okay? So many times you might be fooled in the patient room who are phlegmatics because unless you pay attention, the conversation may go different direction and then they may serve as your caregiver unless you pay attention to. Does it make sense? Because they're so willing to support you. It's their natural role to listen to you, their natural listener. So unless you pay attention to that, you end up finding yourself becoming the care recipient. And you're crying before them, like, they'll take care of you. You have to be very careful about, okay, meeting with care recipient with the phlegmatic. Jennifer is like, there's so many good characters about phlegmatic, good listener, very supportive. They're ready to help you anyway. There's one thing you have to be careful about in your language with phlegmatic. You don't need to praise them because they're going to help you anyway. You don't need to challenge them. They don't need challenge to help you. But they hate to listen. They hate to hear the same message twice. They hate to hear the same request twice. Do not repeat your message twice. So let me ask you, Jennifer, how does it feel when people come to ask you and then they come back to you and they ask you again? How does it feel, Jennifer, when people do that for you?
To me, it feels as if I didn't hear what they said.
Oh, yeah. Didn't I hear them right in the first place? Why did they say again? They don't trust me? This is what they have in their mind when you ask them twice. So do not ask them twice. Just ask them once, and they're ready to help you. Okay? That's the language. Do not repeat. They hate repetition. All right. Any questions, thoughts so far? See how you can use personality theory awareness?
What do phlegmatics like? What do they like to hear, phlegmatics?
Oh, so what they like to hear is all the things that you say, because their hobby is watching you and listening to you. So you don't need to tell them anything, actually. They will listen to all about you as long as you don't repeat. Okay? So they are the ones who will take lowest maintenance, per se, for lack of better terms. But do not disrespect them because they have a very high self-esteem. You need to respect their presence. They are there. Even though they may not look like they're there, but they're there. They are there. And then their presence is very important. So every now and then you recognize their presence. That's good enough. Okay? But don't repeat. They hate repetition. One weakness of phlegmatic people are they tend to go slow. They have their own tempo. So they hate when people come to them and just you need to hurry up. You can't make them go faster. They have their own schedule. Don't you ever try to make me go faster. Am I right, Jennifer? How did I know about that? Yeah. So as long as we don't push them, they'll be all right. So this is about the tempo. Yeah. Phlegmatics have the slowest tempo of making things happen. So for people like sanguine who goes very fast, they may look or feel like, oh, that's so suffocating, but you have to respect their tempo. Good question, Skip. Any other thoughts, questions so far?
What happens if your weakness is the same as your strength score? Like, what does that mean?
I don't get it.
My strength and my weakness are the same. I'm melancholic and phlegmatic for both my strength and my weakness.
Okay, let me see. Jim.
There are high scores for both.
Oh, I see. Okay, so which is good because it does not shift, meaning that you don't need to worry about this shifting tendency of your character. So whether you are high energy or low energy, you pretty much the same type of personality. So you're melancholic phlegmatic when you're in high energy. You still are
Yeah.
melancholic phlegmatic when you're low energy. So it's not confusing for you. That's what it means. Yeah. So means that you're a perfectionist. You try to make your life going perfect in steps, one by one. And then when you're low energy, the one of the weaknesses of melancholic folks are you get so tend to bash yourself, you hate yourself, and you start cussing yourself, looking in the mirror. Okay. Phlegmatic weaknesses are you tend to be lazy and don't want to be involved in the world and what's happening outside, just to go into your dungeon and talk less and close the door. So those are the weaknesses. Yeah. Okay. Any other question? No questions? All right. So I do use other personality theories too, but the reason why I chose this to present to you is because it's simpler and easier for you to remember and to practice in your visits with the patients. Okay. Thoughts, questions, comments? Victor, you've been quiet, which is a character of phlegmatic. Which grade you gonna give me today? And I'm just teasing you. Okay. All right. Any other thoughts? No thoughts? Okay. All right. Ram, did you send me the papers? I mean the signed paper? Okay. Alice, please send me the documents, okay, by today. And then Alice, I'm going to help you with the registration. Okay. So I want you to come back at, let me see, so 5. Can you come back to me at 5 on this Zoom? All right, come back to me at 5. All right, so unless you have any other question, comments, you all have wonderful night. Since you're so cooperative, I'm gonna give you early release. Have a good night. Yes. Bye. I'll see you tomorrow.
See you guys, everybody. Bye-bye.
Thank you.
All right, educators, please
See you guys
stay.
tomorrow.
Great day. Thank you.
Bye. Okay.
Oh, those are so great. It's very practical.
Yeah, so this is an example of how you can help them, the students, the way to be able to use personality theory for their chaplaincy, and
Yeah,
also
it's
for
more,
their own self. Yeah.
yeah, it's very emphasis on self-awareness
Mhm.
and at the same time going into the room and knowing about patient. I think that will be challenging if patient within short period of time, how can we understand their personality? That, I
Good
think
question.
they'll,
Yeah, that's right. So that's a good question. So usually at the end of this presentation, I say, do not try to label them with this personality types, but use this only as a tool of building the rapport and initiating the conversation.
yeah.
Yeah.
I
That's
was
good.
thinking that I was thinking because you're experimental stage, when I go to a patient's room, maybe I can ask 1, 2, 3, stand up. Oh.
That's good. That's good experiment that if you could do that. Yeah.
Okay.
So
Please.
think about how you can present your personality theory
Yeah,
in the manner that how they can use that theory to better provide their pastoral care instead of just using it for the sake of self-awareness.
Yeah, I think they got something because more like your teaching is interaction,
Mm-hmm.
and it's very building up,
right,
and engaging. So that's something that my theory is more like a theory. So I'm thinking, how can I bring that real to them?
Mm-hmm.
Yeah, that's kind of my thinking. Okay,
Yeah.
I'll think about it. Donna's not here. I don't know if she's here or not.
I think yeah, she's working on some uh let me see. Yeah, so Donna just sent you an email that she's not here anymore. Okay.
She's not here anymore.
예, 예. 자, 오늘 어땠어요? 둘째 날?
둘째 날도 굉장히 좋았어요. Very interesting.
음,
학생들도 인게이지를 잘하는 것 같고, 근데 에너지 레벨은 어저께는 근심받고 걱정하고 anxious한 것 때문에 오늘은 좀 학생들이 좀 안정하는, 좀 캄다운하고 그런 에너지가 많이 있는 것 같고요.
음.
의외네요. 굉장히 인터랙션이 많네요, 학생들이.
생각보다 이게 make sense 하고 working 하죠.
네, 오히려 인 퍼슨보다 더 인터랙션이 많은 것 같아요.
그죠? 예.
Very
너무
interesting.
웃기잖아요?
네,
예.
화면을 보고 있는데 어떻게
그래서 이게 참 something fascinating about.
그러게요. 이게
예.
아이러니하네요.
예,
아이러니한.
그게 어떤 경우는 사람들 좀 자기가 스크린을 뒤에 있기 때문에 safer하다고 느끼는 경우도 있어요.
네, 그런 것 같아요.
맞아요. 너무
근데
재밌.
아까 이제 제가 잠깐 생각한 거는 이제 컨플릭트 일어났을 때는 이게 너무 이지 툴로 될 것 같아서 그냥
맞아, 맞아. 예,
just shut
맞아.
up and just leave.
예.
There's
그래서
conflict
컨플릭이
resolution.
한번 사실 일어나야 돼요. 목사님 클래스에서. 그래서 그 컨플릭을 어떻게 퍼실리테이트 할 건지를 거기까지 가야지 목사님이 서티파이가 되는 거예요, 사실. 이렇게 잘 흐르면 좋죠. 잘 흐르면 좋은데 그 중에 학생 중에 하나가 말씀꾸러기 하나 있거든. 그럼 이제 그때 그 말씀꾸러기를 어떻게 recognize 해주면서 근데 그게 두 가지가 들어가는데 trauma informed care가 들어가고 또 하나는 지금 personality 이 두 개가 이제 들어가는 거예요. 이 두 가지가 들어가서 지금 저 친구가 어떤 트라우마를 가지고 어떤 행동을 하고 있는 건데 트라우마 from care 이론 의하면 지금 얘는 사실은 민한 게 아니고 자기가 어떻게 비हे비어 할 줄을 코핑을 못해서 그런 거다. 그럼 내가 코핑할 수 있도록 내가 도와주면 된다. 그래서 난 이렇게 코핑을 도와줬다. 이렇게 되는 거고 퍼스널리티 상으로 보니까 메lancholy가 많아가지고 셀프 에스팀이 되게 로우한데 그럴 때는 퀘션 하지 말고 내가 그 애를 어그날리지 해줘야 된다. 그래서 내가 어그날리지 해주면서 또 리드하고 뭐 그런 거를 이제 그런 게 있어야 돼요. 그게 딱 맞아야 그리고 그게 실제로 그게 이제 프레젠테 해가지고 됐다. 이게 나와야지 그때 이제 목사님이 서리파이가 되는 거예요. 그래서 농담 삼아 그러면 우리 C끼리 하잖아요. 그래서 힘든 학생이 있다 그러면은 그래 그 사람 이제 그 사람 때문에 다시 서리파이 되는 거다 이제.
예,
그걸 안
알아요.
하면은
예.
예, 나중에 뭐 억지로 할 수는 있겠죠. 억지로 할 수 있는데 그게 언제 들통이 나냐면 인터뷰할 때 들통이 나요. 희한하게.
음,
그리고 페이즈 1 인터뷰, 페이즈 2 인터뷰 할 때 들통이 나요. 그걸
음,
한 사람과 안 한 사람. 왜냐하면 그거를 C들이 반드시 질문을 하거든요.
음, conflict resolution.
음. 꼭
예,
컨플릭트 아니더라도 예를 들어서 내가 자랑을 쭉 썼잖아요. 그럼
예,
이런 경우는 어떻게 할 거냐?
음,
이런 경우는 경험이 있냐? 이렇게 물어보면 그래서 확 맡겨버리잖아요. 그러면
그렇죠.
그때 패스가 안 되는 거예요.
그 이제 제가 좀 몇 년 전으로 걸어 올라가서
음,
유닛 4를 들인가 4 들 때 팬데믹이 터졌어요. 4
음,
된것 같아요. 4.
음,
팬데믹이 터졌는데 둘인가 하여튼 그 클래스룸에 그 한 학생이
음.
정말 그 트라우마타이즈된 여자여가지고 흑인 여자인데
잠깐만요. 제가 이게 지금 잠깐만요.
리콜
스테이 해주세요. 금방 들어올게요. 네.
네, 네. 네.